Day one and are ready for day two of the conference. All right, so I'm just going to go over a couple of things. I hope you have all also downloaded the Groupio app. I think it's very helpful. It has all the PowerPoints and downloads on there, and you can take notes right on there. And hopefully you've all learned that you got to save it right away or you lose your notes. And then you can email it right to yourself, and it has the name of the presenter and the title of the slide or the title of the presentation and everything right on your notes. So it's very helpful if you've used the Groupio app. You can also deliver feedback right after the session and send that, and it's anonymous, and we get your feedback about the session and about the conference. So you're welcome to do that as many times as you would like, and use the Groupio app to do that. If you have any questions about the app, you can ask me or ask any of us, and we'll try to help you with that. Right, so I'm really excited to introduce Tiffany Kodak and hear what she has to say today about instructive feedback. So Tiffany is, she was formerly an associate professor and director of the School of Psychology program at the University of Oregon. And so she has just recently moved to the University of Wisconsin in Milwaukee. Days before coming here, I think, right? So she was formerly associate professor and director of the School of Psychology program at the University of Oregon. And prior to joining the faculty at the University of Oregon, Kodak directed the early intervention program at the Monroe Meyer Institute in the University of Nebraska Medical Center, and was a faculty member in the Department of Pediatrics at UNMC. She graduated from Louisiana State University in 2006 with a PhD in school psychology. Dr. Kodak completed her graduate internship at the Marcus Institute in Atlanta, Georgia, under the supervision of Drs. Wayne Fisher, Henry Rohn, and Michael Kelly. Her postdoctoral fellowship was completed in 2006 under the supervision of Dr. Wayne Fisher. Her research has focused on several general topics, including skill acquisition, choice, and the assessment and treatment of problem behavior with individuals diagnosed with autism and severe behavior disorders. She has published 30 peer-reviewed research studies, which I think I've read some of them. I know your name. I've seen your name frequently in the JABA articles. She has co-authored book chapters and worked directly with individuals with developmental disabilities for 20 years. Dr. Kodak is on the editorial board and served as an editorial assistant for the Journal of Applied Behavior Analysis, is on the editorial board for the analysis of verbal behavior, is a board-certified behavior analyst, and the recipient of the APA, Applied Behavior Analysis Dissertation Award in 2006. So let's welcome Dr. Tiffany Kodak. Thank you.
I think it might be. Okay, let's see if I can adjust this so we don't get that feedback. Okay. All right, well, I'm not sure how I can avoid that because it doesn't seem to appear to be related to where it's located. Okay. Well, hello. Thanks, everybody, for coming to this presentation. I know you have a lot of great options because I saw what was listed, and there are a lot of exciting presentations to attend. So thank you for getting up early and joining me, being bright-eyed and bushy-tailed. I see many of you have your coffee, so that's great. That will help you be bright-eyed and bushy-tailed for the rest of the day. Well, thanks so much for coming. Before we get started, I'm actually interested in learning more about the audience. Because I think that would be helpful in terms of presenting information in a way that can speak to those who are here. So I'd love to know who here has heard of instructive feedback before. Show of hands, has anybody heard of it? Okay, great. And has anybody used this in their own practices or maybe in the context of a study? Okay, so, well, that's great. At least some people have heard of it. For those of you who have, I hope that perhaps with the information I present today, you'll have some additional ways that you can implement this with people that you work with. For those of you who have never heard of instructive feedback, that's perfectly fine. We're going to do a review of, I would imagine, everything you need to know about instructive feedback because we do have quite a while. So you'll learn quite a bit about instructive feedback, how to apply it to the individuals that you work with, and hopefully you can get the most out of this presentation. For any questions that you might have, my preference would be you just raise your hand and ask it at any point that you might have a question. I don't believe that there's any such thing as a silly question, so don't think, gosh, I don't know if I should ask that. The reality is if you're thinking it, it's probably the case that someone else is thinking it too. So feel free to ask a question at any point. I'm happy to answer them. All right, so let's go ahead and get started. Let's start by just I want to provide you with an overview of what I plan to talk about today so you can expect what we're going to be discussing. The first thing I'm going to do is provide you with a definition of instructive feedback so that we can identify what it is that we're actually talking about. And then I'll talk about different types of instructive feedback as well, because there are several of them. Thereafter, I'll provide a review of the literature so that you have some information about the studies that have been conducted in this area and what's been done and how that contributes to what we might use with individuals with an autism spectrum disorder. Then, probably people's least favorite topic, but what I consider to be very interesting, we'll discuss the potential behavioral mechanisms that are responsible for the effects of the intervention. And you may be wondering, well, why would we do that? But it is helpful to know what it is about this intervention. Why does it have the effects that it has? How can we explain the effects according to other things that we know about behavior analysis? And in doing so, what that allows us to do is identify with whom this strategy might work and with whom it may be unlikely to work if we can actually identify those mechanisms. We'll also talk about child behavior that could impact the effects of this procedure because it might not work for everybody, and there might be certain behaviors that allow us to make the strategy effective and certain behaviors that if we aren't seeing them, then maybe we don't want to be using them with these individuals. And so I think it's important to talk about that as well. We'll talk about some novel applications of instructive feedback because as I review the literature, you'll see there's some overlap in terms of the way this has been structured, but by no means are we tied to the way that that's been done. We can use it in a variety of different ways. We'll talk about some considerations for use in clinical practice or in classroom settings because we do want to be using them in these settings and what do we need to consider when doing so. And then finally, we'll talk about some potential extensions of the research if you're a student or if you're interested in conducting research in this area. Or maybe even to see what you might want to look out for in the future. Okay, so let's start by providing a definition of instructive feedback so that when I use that term, you know what I'm talking about. Instructive feedback involves presenting additional information in learning opportunities. And that information can be presented in a variety of different locations within a learning opportunity. It could be presented at the very beginning of the learning opportunity. It could be actually presented within that learning opportunity, or it could be presented in the later portion of that learning opportunity. And I'm going to refer to these a little bit later by different names. So when I say that information could be presented before the learning opportunity, I would call that antecedent instructive feedback. It's in the it occurs before the primary behavior of interest. Within, well, we're not going to talk about that a whole lot, but there is no additional term for that. When we're talking about the after portion, so if the instructive feedback is presented after the learning opportunity, I'm going to refer to that as consequence instructive feedback because it's occurring in the last portion of the learning opportunity. What's interesting about this strategy, which is very different from the other strategies that we tend to use, is that the child isn't actually required to respond. So we present this additional information, but the child doesn't have to do anything. And we're not providing any feedback for a response if it happens to occur. And this might seem strange because for many of us who work with children, we oftentimes require responding. If they don't respond, then we actually provide some type of prompt to get a response, and then we provide reinforcement. So it seems odd that this strategy works so well, and I'll describe how it works so well later, but yet the child isn't required to respond. And I remember when I first learned about this strategy thinking that was really bizarre, and it seemed very different from everything that we know about behavior analysis. But that is the way that the strategy works. This additional information isn't actually considered a target. It's extra information that we add into the learning trial, but that doesn't necessarily mean that the child has to respond. And so we're not really considering it a target. It's extra information we would love for the child to learn, but it's not something they have to respond to. However, it could become a target in the future. So if the child doesn't learn that extra information, then we probably want to directly teach it at a later point in time. much of what I'll be talking about is actually when we present the information when it's not yet considered a target. So we're not yet actually attempting to directly provide any feedback for the child responding. We're simply presenting this extra information. And in a little while, I'll describe how that kind of matches what we do on a regular basis in the natural environment when we just comment on or talk about things that children are doing. So you see that although I'm describing this procedure, you probably do this on a regular basis, but maybe just don't realize that you're actually doing it. So instructive feedback, as I indicated, can be presented in a variety of different locations within a learning opportunity. And one location that can be presented is in the antecedent, or before the learning opportunity. And so I provided a diagram here to try to help provide an example of what I mean by this. So the instructive feedback stimulus is the instructive feedback, and I'll give you an example. This might involve saying something like, you read a book. Then you present what you're actually going to be teaching. So let's say you ask a child the question, you wash your hands with, and then the child is expected to respond to this. So if the child provides a response that's relevant, so let's say the child says soap, then we would provide some kind of feedback. So we'd say, yeah, that's right, and then maybe provide some type of reinforcer. What I haven't mentioned is what happens if the child actually does respond to instructive feedback. So I want to mention that now. So this diagram is the same with the exception of there being one additional component. So let's say we say, you read a book. Now again, the child isn't required to respond, but what you might find is that children do sometimes respond. And if we find that they do, so let's say the child says book, we say nothing, and we just moved on to our target stimulus, which is you wash your hands with, and then the child's expected to respond. So again, I know this seems strange because the child's saying something correct, so why wouldn't we provide some type of feedback? But this strategy doesn't require it. You can kind of think of the strategy as what I would consider to be the least intrusive form of instruction. You're essentially just telling people things and seeing if they learn them, which is kind of a novel concept. All right, so, and not one that we're really familiar with. So instructive feedback can also be presented in the later portion of the learning trial or in the consequence portion of the learning trial. When we're doing this, we're basically just restructuring what I already described. So this example is the same. So we would start off by presenting what we actually want the individual to learn. So we would ask, you wash your hands with, hopefully the child says soap, and we would say, yeah, that's right. And then we would deliver reinforcement. While the child is consuming that reinforcer, we would then present instructive feedback. So we might say, you read a book, while the child is doing whatever it is that they're doing to consume that reinforcer. It might be watching a video, or playing with a toy, or maybe putting a token on a token board, or whatever it is. Now, you may be thinking, I work with some children for whom presenting something during reinforcement might be a problem. I'm not so sure that they would benefit from this. There is another type of consequence-based instructive feedback that I'll talk about, and so you can use either one of these strategies. The second type actually involves presenting instructive feedback right before you present reinforcement. For kids for whom you think they're probably not going to benefit if we actually provide it while they're watching a video. I know for the kids I work with, if they're watching a video, they're probably not going to listen to what I have to say. At that point, they're doing something else, and I'm preparing for whatever I'm going to present next. So another type of instructive feedback involves presenting the information just before reinforcement. So here, again, we might ask, you wash your hands with, the child says soap. We might say, yeah, that's right, you read a book, and then provide reinforcement. So that's another option that you have for placing instructive feedback in the consequence portion of that learning opportunity. You can do either one, and you can pick whichever you think might work best for the child that you're working with. Maybe you don't know what works best, and so you could try either one and see what happens to work the best, and that would be fine too. Instructive feedback that occurs within the learning opportunity has not really been investigated as often, but I actually think this is a really interesting area that we can provide instructive feedback because it's, well, then the next example I provide, you'll see it's a little more relevant, but it's actually a way that we can almost enhance this instruction, but not have to say a whole lot more. So the example I have first is that perhaps we're going to teach, let's say, fruits and vegetables. So we might say something like, cherries are, and we expect the child to say fruit. Or we could say asparagus is a, and we expect the child to say vegetables, or vegetable. But we could also present some additional information within this learning opportunity. And the way that we can do this is we could say something like, cherries are a red, and then the child might say fruit. red doesn't have to be there. That's what you're embedding into that presentation so that hopefully you can teach them extra information. And then later on, you might go back and say, what's a red fruit? And the child might say cherries. Or maybe you say blackberries are a black fruit. And you say a black fruit is, and then the child would say blackberries. So it's a way to add some extra information into what you're already presenting that doesn't really involve any extra time. So I think that's kind of an interesting application, and not one that's been investigated as often. Another way that we can do this, and actually a way that I really like to do this, is to embed some information about categories when we're teaching information about the item itself. So if we're going to teach somebody that a picture of a plane is an airplane, or maybe this little toy airplane I have is an airplane, we could add some information into that opportunity to also teach categories at the same time. So we might say, what vehicle, or what form of transportation, or however you want to describe airplanes, as well as other vehicles. And if the child says airplane, we might say super duper. But what's interesting about that is we're not really doing a whole lot of anything different. We're just basically presenting some information about the category within that opportunity. And what's incredible about this strategy is that it works, is that children actually learn this information, yet it involves so little extra work on our part. And so we'll talk more about why this procedure is so versatile and useful in the practices that we engage in with children. I think one of the most confusing parts about this literature base, when I started to become very interested in instructive feedback and try to learn more about it, is that people call it different things. And so that can become really hard when you're reading to try to learn, well, what should I be doing with children? How can I enhance their instruction? And it's called one thing in one study and called something different in another study. And so what I'd like to do is at least tell you the other names that this procedure has been referred to, so that if you happen to come across this, you realize that this is also instructive feedback. It's just being called something different. And oftentimes we see this happen when studies are published in different journals, because journals like certain terminology and other journals like other terminology. And I know that sounds strange, but that's the reality of journals and their preferences for calling things by certain names. So other names for instructive feedback are future learning stimuli. That makes sense. We might teach these in the future, or hopefully we hope children learn them in the future. Maybe that's where future comes from. They've also been referred to as non-target information, and that's true because they aren't the targets of instruction. They're extra information that we're adding to instruction. And it's also been referred to as secondary targets. And so they're not the primary targets of instruction. They're secondary pieces of information that we add to a learning trial. So there are other names, and I want you to be familiar with those so that if you happen to come across a study that uses that name, you realize that's also instructive feedback. We're all talking about the same thing, just using different terms for it. Okay, so there are different types of instructive feedback as well. We've talked about where you place that information, but we can actually present instructive feedback in different ways, or we can categorize this by types, depending on what you're actually presenting and what extra type of information you're adding into that learning opportunity. And so I'd like to review these different types, because that will help you identify the vast ways that you can provide this extra information when you're teaching. One type of instructive feedback is called expansion instructive feedback. And here, the target and the instructive feedback stimulus differ. So they're not the same, but they are related, or they're from a similar type of skill. So as an example, let's say that we're teaching a boat. So we might hold up a picture of a boat, or maybe we are at a harbor and we happen to see a boat. And so we use that as an opportunity to teach boat. At the same time, we could also include an instructive feedback stimulus such as an airplane. And that is a different piece of information, but it is related in that these both involve labeling things or tacting. And these also both involve a similar type of skill. So we're teaching a child items that are both vehicles or items from the same category. Oftentimes, when we're teaching children, we usually teach in groups, or I would describe it as being fairly common to teach in groups. So we might have a program in which we try to teach a child different forms of transportation. And so we pick a subset of forms of transportation, and we might teach those at once. What's nice about this strategy is we don't have to teach all of them. We could directly teach some and then use instructive feedback to teach all the other ones that we're not going to directly target. So this type of instructive feedback offers the opportunity to do so. Another type of instructive feedback is probably the most versatile, And this involves unrelated materials. So basically anything goes here. You could present one target, and then the instructive feedback target is something that's completely different and not from the same skill area. So for example, I might be teaching boat, and so I show an individual a boat, and that person says boat, and then I might say, you read a book. So that's completely different. It could be any particular skill that you have determined to be relevant for that learner, and this would also be an effective strategy. Again, you can see now why this is fairly dynamic in that whatever you're going to teach, you could present within the context of unrelated instructive feedback. The third type of instructive feedback is one that hasn't been examined as often, but I think is kind of interesting, particularly for those who are interested in sight word instruction. And this involves parallel instructive feedback. So here, the target and instructive feedback stimuli, again, differ, but the response is the same. So for example, I might show a picture of a boat, the child says boat, and then I'm going to show the printed word boat and just read it for that person. So I might hold up the printed word boat and say, boat, and that's the instructive feedback stimulus. What's really interesting, yeah, go ahead.
Do you use the same targets each time you're doing, because we do intensive teaching, do we use the same targets every try or every session that we're doing it, or do you vary up the targets so that you're getting more information, or do you keep them similar, or keep the same ones so that you can keep the data on if they're able to obtain those skills?
Yeah, that's a great question. I'm going to repeat it because of the live web streaming. So the question was, when you are presenting this information, do you keep the targets the same, or can those vary over time? Ideally, you probably keep them the same, mainly because it's a little bit easier to arrange something like that. I don't mean that they have to be the same and that you can only show one picture of the boat. If your strategies involve using 3 different pictures of boats and presenting that on an ongoing basis, you can still do that. But what I would recommend is that you limit the vast number of items that you present. And we're going to talk more about why it might be helpful to some extent to pick a few things and kind of stick with teaching those repeatedly, as opposed to presenting, maybe 100 different things all at one time. So we will talk about that in a little bit, but that's a great question. You probably want to at least stick to a few if you're teaching some type of skill, and then use those repeatedly until the individual learns those specific materials. Okay, so any other questions on types of instructive feedback or the definition before we move on? Because a lot of the information will build upon this, so just want to make sure that we're comfortable with that.
So you can use more than one, like in a session. You could have said what kind of transportation, which would be an antecedent IF, and then they said boat, and then you said, that's right, and then show them the word, and then like show them the boat, you said boat, and that would be a consequence IF.
What you described sounds like consequence IF, but yes, you can do that. So you could say something like, tell me a form of transportation, and the child says boat. And then you could hold up a picture of a boat and say, this is a boat too. Maybe because that child has only learned one example of a boat, and you want to use that opportunity to get some generalization with other types of boats that they haven't yet learned. That would probably be consequence-based instructive feedback, and that's because the first part that you described actually requires a response, and you're going to provide some kind of feedback based on that response. So that's what I would describe as probably a common learning opportunity, and then you're adding something else into it at the end of that opportunity. So you're holding up a new picture of a boat, or maybe you're holding up the printed word boat, and you say, this is a boat too, or you could just say boat, and then move on. The child's not required to respond to that last piece of information. That's the instructive feedback, but they are required to respond to that first piece of information, which is just that standard learning opportunity that you plan to present all along. Does that make sense?
Yeah, I think I explained it wrong.
That's okay. I'm glad that you asked, because I just want to make sure that that's clear. So let's take the instructive feedback out of this and just talk about, if you're teaching students things, you typically expect a response from them. So anytime you ask a question or anytime you present some material and they're expected to respond, and if they don't, you're going to provide some type of prompt. Maybe you provide it before, maybe you provide it after, depending on where you're at in learning. If they're expected to respond and you're delivering some type of feedback for a response, that's not instructive feedback. That's what I would consider to be, standard educational practice, where you're trying to teach somebody something, they're expected to respond, you provide feedback for that response in some way. Instructive feedback is when you add something else and the person does not have to respond. So, for example, if I asked somebody, what color are these chairs? And somebody said, brown, exactly. So that is the learning opportunity. You all know this already, but that's okay. That's the standard learning opportunity. I'm asking you a question, and I'm expecting you to respond. If you didn't respond, I would say, they're brown, and then wait for you to repeat that. And then I might say, yeah, that's right. Then I want to present something else. So I might say, we're in a brown room, too. So that would be the instructive feedback stimulus. I'm adding something to that opportunity that wasn't going to be placed there without some strategic inclusion of instructive feedback. And you don't have to say anything. I'm just basically telling you, hey, this room is brown as well. And then you might note that, yeah, it is kind of brown. Maybe it's actually tan, whatever, that's fine. But you don't have to respond to that, and I'm not going to expect you to respond to it. If you did respond, I'm not going to provide you with any feedback for that response. So if I said the room is brown too, and you said, yes, the room is brown, I'm not going to comment on that. I'm basically going to move on to whatever else I was going to do. Does that make sense? Okay. So you might be thinking, well, this is interesting. How does this really increase the efficacy, or actually I should say efficiency, of the learning strategies that I'm using already with my students, or that I'm using already in the context of my clinic or wherever you work? And there are a variety of ways that we can define efficiency. There certainly isn't just one definition. And so I'd like to describe a couple of different ways we can measure efficiency, and then talk about how instructive feedback relates to these specific measures. So one way that we can talk about enhancing the efficiency of instruction is that we're able to teach information in less time. So if we find that when we're teaching somebody something, and that takes 30 minutes, but then when we teach that using some other strategy, it takes 50 minutes, we would consider the first strategy that only took 30 minutes to be a more efficient strategy. It takes less time to teach that skill. And oftentimes, the instructive feedback research has looked at efficiency in that way by basically measuring how many pieces of information did the child learn and how much time did that take. So for example, let's say I taught let's say I taught 10. I taught 10 targets, and then I also had 10 instructive feedback stimuli, so 20 items total. And let's say that the child learned all 20 of those, and that took 20 minutes. I would then divide the total number by the amount of time, and then that would equal about 1 minute per item. That's pretty good. If it only takes a minute to teach something, that's pretty impressive. So I would say, yes, that actually increased the efficiency of instruction, because when I used instructive feedback, I could teach items at 1 per minute. When I didn't, maybe I taught 10 also in 20 minutes, and so that would be 2 items, or that would be, 1 item per 2 minutes. Let's see if I can do my math this early. That would be 1 item per 2 minutes. That's less efficient because it takes more time to provide instruction some other way. Okay? Another way that we can look at efficiency is in terms of the amount that's actually learned. And if people learn more, then it's more efficient. So for example, if I can teach 10 things instead of just teaching 5, then I would also describe that as being more efficient. And certainly with instructive feedback, that's an easy way to think of it as being more efficient, because oftentimes, whatever we're going to teach, we just double that number by including instructive feedback. So if I'm going to teach 5 things, I also have 5 instructive feedback materials. Or if I'm going to teach 10 things, I also have 10 instructive feedback materials. So I'm basically looking to try to double the amount of information that the individual learns. So those are 2 ways that we can define efficiency, and 2 ways in which the research on instructive feedback has examined efficiency. Okay, so I'm going to go into talking about some of the research on instructive feedback. I'd like to provide you with a caveat to this. This is not my research, and so a lot of this is trial-based. And oftentimes when I'm presenting to a group of people, people want to hear how to use strategies that aren't just trial-based. And I recognize that that's very important. We'll talk about how to do that in the future, but I can't control what's been done. I can only report to you what has been done. And so what you'll find is that a lot of this is occurring in the context of trials, or at least learning opportunities that are highly structured. But it has been done in a dynamic in a variety of ways that, although it is still structured, it probably matches a lot of what we're actually doing on a regular basis. And if that research doesn't match what we're doing on a regular basis, and we do a lot more natural environmental training, or we do a lot more training in the context of like play with children, we can also use that strategy in those contexts, but we need more research in this area, and we'll talk about how to apply it to this area later. So I want to provide that caveat because I don't control what's already been done. I just want to report to you what has already been done. Okay, so research on instructive feedback. There is actually quite a bit. There are at least 30 studies demonstrating that this procedure works. 30 studies is a pretty good number, and actually there's more than this. I was counting studies for the purposes of placing this number, and then I put the number in there, and then I actually came across more. So this is an underestimate, but there are at least 30 studies that have shown that instructive feedback works. And what's interesting about this strategy is that it can work to teach a lot of different skills. And studies have actually looked at teaching a number of different skills. And so I consider that to be a strength because it's not just been used for one type of skill. It's actually been used for a lot of different skills. For example, people have taught sight words, tags or labels of items, interverbals, so question and answer, categories, grocery store information, that's kind of neat, play-related behavior, among others. So this is just some examples of the different types of skills that you can teach when using instructive feedback. It's also been found to be effective with a lot of different populations, which I think is also a big strength of this literature base. So this strategy has been used with, I listed preschool, elementary, middle school. I didn't list high school, but that's also included in this list. So basically, pretty much any age individual that's in an academic setting. I would be shocked if there weren't also studies with adults, although I can't think of any off the top of my head. I'm sure that there are. It's also been used for people with different types of diagnoses, like hearing impairments or language impairments, moderate intellectual disabilities, mild intellectual disabilities, adolescents with behavior disorders. So a variety of populations have been included in this literature. Unfortunately, though, there's only a few studies that have looked at applying this strategy to students with an autism spectrum disorder. And so although this has been shown to be effective with a lot of different children, there is more work to be done in the area of applying this strategy to students with an autism spectrum disorder. There we go. And I'll just describe one quick study because I'm familiar with it since it's a study I conducted with a student. So we used instructive feedback with children with an autism spectrum disorder to identify whether this strategy works well for the population with whom I typically work, which is young children with an autism spectrum disorder. And so we taught tags or labels of items, as well as question and answer. And we used a couple of different types of instructive feedback. So we used presenting that information in the beginning portion of the trial, presenting that information in the ending portion of the trial, and then we came up with something that was weird that we didn't think would work and was actually going to be a control condition, but we had this serendipitous outcome that, in fact, it actually worked, which was strange for us. So we also used what's called instructive feedback only. And so what this involved, which is going to seem very strange, is we basically just told children things. And that was it. And they weren't required to respond, and we didn't provide any reinforcement. So what that might have looked like is we might have said something like, you comb your hair, you eat hamburgers, you blah, blah, blah. It was basically just, we were just telling children information. Once in a while, we gave them opportunities to engage in some type of maintenance tasks or tasks that we had taught previously where they could respond and get some reinforcement just so that they continued to stick with us. But we really didn't expect this to work because it wasn't actually embedded in a learning opportunity. We were just telling children things. And if that works really well, then why would they have a language delay to begin with? So we didn't really expect this to work, but it did, which is strange, and we'll talk a little bit more about that later. So we also presented instructive feedback only, which means it wasn't actually in a learning opportunity, it just occurred. To identify whether children were learning these stimuli, we conducted probes, and so those probes involved not providing any type of feedback for a response. We just asked the question that was related to the instructive feedback, saw if the child responded, and then moved on. So we didn't provide any feedback or reinforcement for correct responding. And that's really important in these probes because what we wanted to make sure was that the children were actually learning the instructive feedback because we were being presented in that learning opportunity and they weren't learning from those probes that we were conducting, where we were directly asking the question and seeing if they had a correct response. So we didn't provide them with any type of feedback whether those responses were correct or not. We were just using those probes for the purpose of identifying whether children were learning that information. And what we found is that all the participants learned the targeted information, so the information they had to respond to, which is what we would hope, But interestingly, 3 participants also learned all of the instructive feedback stimuli without any type of additional training. And I wouldn't describe these children as being uncharacteristic in any way from other children that we might work with. These children had some fairly substantial impairments, and they were working on some basic skills. So either basic labels of items, common items that you might encounter in an everyday environment, or they were working on some fairly early questions like, you eat hamburgers. I don't know why I keep using that as an example, but some pretty common questions. Or a cat says meow. And so I would describe these participants as being fairly common of the children that I tend to work with in early intervention. And they all learned these all but one, learned these instructive feedback stimuli without any additional training. There was one child who did not learn these instructive feedback stimuli without additional training. And what we found for that particular child is that that extra training time took as much time as it took to teach those skills directly. So for one child, it really didn't offer any type of advantage using instructive feedback. And so I would describe that to be a fairly frustrating outcome, because why does it work for some and not for others? And we find this a lot with behavioral interventions, where it's hard to predict for whom it's going to work. We find that, hey, it works for these 5 children that I work with, but then it didn't work for child 6 and 7. And why does that happen? And so I'd like to talk a little bit about that later, and how we can start to identify the children with whom these procedures will work. But I do want you to note that there was one child who didn't benefit from instructive feedback. But interestingly, all of the participants learned in instructive feedback only. So they all learned when we just told them things, which again is not really what we would expect, because we tell children things all the time, and we don't find that they learn those things that we tell them as often as we might like. So this was not something that we anticipated, but it was a good outcome nevertheless. And we'll talk a little bit later about why that might happen and how we might structure things in a way that helps children learn when we just tell them things. The studies on instructive feedback, which I think is a really big advantage of this literature, have been conducted in a variety of settings. So oftentimes what we find when we look at studies on behavioral interventions, they're usually conducted in these really what I would describe as contrived settings. So they're clinic settings, or they're settings where it's a particular room and there's no distractions, there are no other children around. So not really settings where we're teaching children most of the time. And so that can be a limitation of some of the behavioral research, but that's not a limitation of instructive feedback. It has been used in a variety of settings. It's been used in preschool classrooms, it's been used in general education classrooms, it's been used in clinics, it's been used in self-contained classrooms, it's been used in transitions in school settings, which I think is kind of a cool one, and I'll explain that study later. And it's been used in other settings as well. Unfortunately, though, there is more need to conduct these types of evaluations in other settings. And the main settings that we need to extend this to are what I would describe as more community settings. So all those opportunities are available when people are out doing things around town, or perhaps at some kind of social event. And these really offer wonderful learning opportunities. So for example, if you go to the mall, there's a lot going on at a mall that you could talk about with somebody. There might be people who are shopping, and what are they shopping for? There might be a playground, and some children are playing on that playground. Especially if you live in the Midwest, there are a lot of playgrounds inside of malls because it's cold, and so they tend to have places for children to play inside. And so there are a lot of opportunities to present instruction there too. Unfortunately, though, we don't know a whole lot about how this procedure works in those settings. Yet that might be a context in which we really want to be using this strategy. So I would argue that there needs to be more research in these, in other types of settings that are probably consistent with where we want to be providing some instruction. Not related to settings, but still related to what we need more research in. We do need more research on different types of instructors. So there has been research that looks at paraeducators, special education teachers, general education teachers, psychologists, behavior analysts, speech pathologists, all providing instructive feedback. But there is very little research on parents providing instructive feedback. Yet I would describe parents as being this great resource where they provide so many wonderful learning opportunities to children. If we can teach them this skill and they find it to be useful, then this would be a really powerful strategy for parents to use. Because as I'll describe later, it looks a lot like what parents are doing anyway. So it would be great to see more research on how parents view this strategy. Do they view it as being useful? Can they use this and find that it's effective for their children in their home-based setting? It would also be wonderful to see siblings using this strategy. Not every sibling is going to be, a relevant instructor. But for example, I have 2 children. They're 6 years apart. My older daughter and my younger son. My older daughter spends a lot of time teaching my younger son. Whether my younger son likes it or not, she is, a mini instructor. She tells him a lot of information, some of which is not what I would like her to tell him, but she still does. And so she is a wonderful person to provide instruction to my son. And she teaches him a lot of things that I don't teach him. So I think that that's really interesting. And I think it would be wonderful to see children with an ASD who have a sibling really have that relationship where maybe their sibling can tell them information. The nice thing about instructive feedback is it really is basically just telling people things. The child doesn't have to respond, so a sibling could easily present this information. If the children are playing, the sibling could say something like, "That dinosaur has a long neck." And that's instructive feedback. The child doesn't have to respond. The sibling doesn't have to provide any type of reinforcement. If the child does respond, the sibling is basically just commenting on what's going on. So it seems as though this strategy is really amenable to use with siblings, and it'd be nice to see more of that research as well. And in addition to that, it'd be great to see peers using this strategy too, and we'll talk more about that later. Instructive feedback has been conducted in a variety of different types of arrangements. When I say arrangements, I mean grouping of children. Certainly it's been conducted in a one-on-one context. That's probably not very surprising because it's easy to arrange individualized instruction in certain contexts where one adult is dedicated to instruction of one child. But unfortunately, this type of context is not common in general education settings, and it's not very common in special education settings either. Sometimes there are opportunities for one-on-one instruction, but oftentimes instruction is happening in small groups or in large groups. Fortunately, there have been studies that have looked at providing instructive feedback in these contexts. So there are some studies that have looked at instructive feedback in small group settings. Usually, when these studies have been conducted, all of those students are working on similar types of skills. And I want to present a really cool example of use of instructive feedback in a small group setting to help kind of set this example. Okay, so Schuster and colleagues in 1996 looked at small group instruction. And they were teaching grocery store words to students as well as a peer. And so that's a novel application. How often do you teach grocery store information? I would argue it's an important piece of information to teach, and so it's kind of cool that they did something that was a little bit outside of the box. The instructive feedback involved presenting information about the function of items or the location of items in the store. So for example, we might teach paper towels are used to clean up spills. I almost said skills. Clean up spills. And that would be the function of paper towels. Or we might say a pharmacy is where you get medicine, and that would be the location of where you might find items in a store. Again, both of these are relevant pieces of information if we're teaching somebody to go out into the community and purchase items that are relevant to various types of things that they might do with them, as well as identify where you might find those items. I have been in grocery stores before, like Costco, where it's incredible how much is there and how much is going on. And if I had to wander the store to find everything, I could be there for hours. If I know where certain things are located, that really helps me isolate where I'm going to go in the store so I don't end up standing there, or I don't end up walking through the store for multiple hours. So it's helpful to teach people information about where you can find things. So what was really interesting is that this study also looked at observational learning. So they weren't just looking at whether the participant learned their own information, they were also looking at whether the participant learned information that were presented to other people that were in their small group. And I think this is really cool because we don't see this very often. And so what they found was that the children learned all of the skills they directly targeted, so the skills that the child was required to respond to and that received reinforcement. And then they learned also about 83 to 100% of the instructive feedback stimuli. So that's all that extra information that they didn't have to respond to. So right there, they really almost doubled the information that they were teaching people by using instructive feedback. On top of that, they have this extra really interesting component where they looked at, did they also learn what the peers were the instruction that the peers were receiving? And that produced some interesting outcomes as well. So not only did they learn what they were taught and the instructive feedback presented to them, they learned some of the peers' targeted words and 81 to 100% of the peers' instructive feedback stimuli. That's a really powerful demonstration of the amount of information that can be learned in this small group context. So not only were they learning what they were being instructed, they also learned what another peer was learning. And I think this really presents a powerful demonstration of how using a strategy like this can really lead to a lot of learning outcomes. Yes?
Did they indicate
there was nothing required?
That's a great question, and actually will be a point that we talk about in the future. I would argue that's probably critical, but there has been very little discussion of this in studies until recently. So I assume that happened, but we really don't know because people weren't really reporting this, nor were they measuring, was there any difference between whether children learned if they did or didn't do that. So I think that's a really great question, and that's smart of you to think of that. And I think we need more of that type of information within these studies. Again, to indicate what is it about these children, or what is it about their skills that's helping them do exactly what they're reporting. And unfortunately, they didn't have information like that, but it would have been helpful. I would assume they probably did, but you just never really know if it's not reported. So there are also studies where they have evaluated instructive feedback in a whole class setting. And again, this is pretty cool because how often do we see behavioral interventions being used in large group settings, particularly skill acquisition programs where it's applied to an entire classroom full of kids. And this was a general education classroom. So I'm going to describe this study as well because it shows that maybe we can actually apply these strategies to large groups of children that have a variety of different skill sets. So Wertz and colleagues in 1996 used instructive feedback in a whole class. It was a kindergarten classroom. And the kindergarten classroom was comprised of children who were typically developing as well as children who were included in that classroom. So children with developmental disabilities who were included within that classroom and receiving instruction. And they taught coins or coin combinations, and then they used instructive feedback to teach the coin values. And this instruction occurred within the kindergarten during the transitions in that classroom, and they presented 4 trials per day to the entire class. The class was required to engage in choral responding to the targets, and then they presented instructive feedback as well. I thought they took an interesting approach in terms of prompting or providing reinforcement. So what they did was they looked at children with developmental disabilities during those choral responses to see was a child, for example, a particular child with a developmental disability, responding correctly to the choral response opportunity. If the child did, then they presented reinforcement. If the child did not, then they prompted the whole group to practice that again. Again, those were just the targets, though. So those are what they were directly teaching, which were the coins or coin combinations. They used instructive feedback to teach the coin values, and they did not require responses for that. And so what they found was that 5 out of the 6 typically developing children learned all of the stimuli. That's the instructive feedback stimuli as well as the targeted stimuli. Maybe this is not as much of our area of interest, but I'll talk about why this is still important. Unfortunately, none of the children with developmental disabilities learned the stimuli without some type of modification. And that modification usually involved extra learning opportunities that were more individualized, that involved some one-on-one instruction. Now that's, to some extent, a little bit of a disappointing outcome. However, remember I mentioned there were only 4 learning opportunities per day. And so a lot of times when we work with children with developmental disabilities or children with an autism spectrum disorder, we provide more than 4 learning opportunities in one day. We expect that there's going to need to be some kind of repetitive nature to instruction in order for children to be learning these skills. So it might be that this strategy would work just fine had they presented more opportunities. And so I would argue that if this would be great for somebody to do again and just present more of those opportunities per day. And if they did, maybe we would find that there is no need for individualized instruction if there are a sufficient number of opportunities to practice this skill in that whole group in the entire day. But I think what's really beneficial about evaluating this in a whole class setting, especially a general education classroom, is that we can make recommendations to teachers that are useful for the entire class. And I think that really helps get some teacher buy-in when you can say not only will this work for the children who are included in your classroom, but it also works to teach some skills to the typically developing children too. And so this strategy has utility for everyone in that classroom. It's not just useful for a particular subset of those children. And I think when we can find an intervention that works in that way, then it really helps us get buy-in into people being willing to use these strategies because it's beneficial to all and not just some. So I think this is an interesting area in which instructive feedback could certainly be expanded upon. All right, well, you might be wondering, how do we know if instructive feedback targets are learned, particularly if we're not requiring children to respond and we're not providing any feedback? And if you've been wondering about this, then that's very wise of you. And if you haven't been wondering about it, that's okay. I've kind of alluded to this anyway. We need to have some way to measure whether children are learning these skills because we're not requiring them to say anything or do anything. So how do we know if they're actually learning? So there are ways that we can evaluate whether children are learning these instructive feedback stimuli. A really common way that people have done so is to conduct baselines or some kind of probe before they use instructive feedback, and then to conduct some kind of baseline or probe after instructive feedback has been presented and all of the targets have been learned. And so I'll present you with an example of this from a study by Woolery and colleagues. So they looked at, so this is an example of one participant, and they used instructive feedback as well as conducted some direct training. On this graph, we see the percent of correct responses along the y-axis, and sessions are along the x-axis. The top panel shows everything that they trained. So these are the pieces of information that the child was required to respond to and that they provided reinforcement for a response. And in the bottom panel, these are their probes of instructive feedback stimuli. So were the children learning all that extra information they were presenting? And what we see is that they used the strategy of conducting the probes before they ever included this additional information. And then they evaluated whether the child learned after they had included that additional information. In this particular case, the child had learned some of the information, but was not at some kind of predetermined criterion, and so they conducted some additional training. Unfortunately, what we don't know is what's happening in that in-between time. So what's happening when we're actually conducting the training and embedding this information into that training? Might children learn during this period of time? We really don't know what's happening here, and that's unfortunate. So I would argue that we might need to measure learning on a more consistent basis. And there have been 2 studies that have looked at conducting probes while training is actually ongoing and this information is being added to that training. And at least in one study, we found that the instructive feedback were actually acquired during training. So it's not that we have to wait until after instructive feedback or after training has already been completed to see if instructive feedback has been learned. We might actually find out that they're learning while we're actually providing that training. What's interesting about this is I would argue that there are some benefits to conducting these ongoing probes. And let me give you an example of why. Let's say we're teaching a skill and it takes 20 opportunities to teach that skill. 20 opportunities where, let's say 20 days. If we find that the instructive feedback stimuli are learned on day 3, then what happens is we have 17 more days that we're presenting that information that they have already learned. But we don't know that because we're going to wait until the other information that we're directly teaching has already been learned, and that takes 20 days. But I learned the instructive feedback on day 3, so I'm spending a lot of time with you telling me things I've already learned. That's not necessarily a way that we can enhance efficiency as much as we might want to. So if we conduct these ongoing probes and identify that children are learning this information fairly early on, then we can actually pick a new set of instructive feedback stimuli to add in while we're still conducting that training. And I know this seems strange. Why would they learn instructive feedback before they learn what we're directly teaching? But surprisingly, I have actually had a pretty decent amount of experience in which children are learning this information more quickly. And I'm going to present both a clinical case example as well as a study where you'll see that some children learn these stimuli more quickly than what we're actually teaching, which is very bizarre. And every time I see it, I keep thinking, why does this happen? This is so weird. Seems like we're doing the wrong thing. If we're directly requiring children to respond and providing reinforcement, and they learn that more slowly than when we just tell them things and they don't have to respond, that seems weird. And yet, it works pretty well. So kind of a novel outcome. But it still would be helpful to evaluate at what point they're learning this information. So if they've learned it, we can incorporate new information in those opportunities. And we might find that they can learn several sets of instructive feedback stimuli before they actually learn what we're directly teaching. Okay. So does anybody have any questions before I move on to this next part? All right. Well, what I find a lot when, so I've concluded the review of the literature, so we're done with that component. And what I find a lot when I am recommending these practices to parents or to teachers, I hear a lot of people say, I think I do this. This sounds just like what I do on a regular basis. I comment upon or I add to what the child is doing and saying. And that's true. They're right. It absolutely does look a lot like what people naturally do anyway. And quite frankly, this commenting on or adding to information is what we hope a quality instructor does. So the child does something, and the person adds to that by saying or doing something that the child hasn't done. This is the hallmark of quality instruction. And so a lot of times people say, well, I do this. And they're right, they probably are. For example, let's say that we're at a park and a child says, dog, when they see a dog walking by. We might say, yes, that dog is a poodle. So we're adding information. They said it was a dog, and that's true, it was a dog. That was a child-initiated learning opportunity. And instead of just saying, like, yep, you're right, we add something to that. So we tell them what kind of specific dog that might be. Or maybe there's an airplane flying in the sky, and the child, or the adult, the child is playing with an airplane, not flying in the sky, but whatever, that's irrelevant. So the child's playing with an airplane, and we might say something like, airplanes fly in the sky. Certainly, I'm sure you can think of examples when you've been playing with children and you said something like that. Maybe the child labels the letter B at circle time, so the teacher is holding up letters and the child says B. And the teacher says, birds start with B. And then maybe some other children comment on other things that start with B as well. I've certainly seen examples of that in classroom settings. Or maybe a child finds a nickel on the ground and holds it up and shows it to their parent, and the parent says, yay, you found 5 cents. For those of you who have worked with young children, we know that they pick up money all the time, and that's very exciting. So we oftentimes don't just say like, yep, when the child says that, we add in some way to that information. Or they might say, look, I found something. They don't know what that coin is, and you say, oh, you found a penny. Or that penny is worth 1 cent. And that sounds really exciting. Or you might say, yay, it's your lucky day, because it's a lucky penny. So there are a variety of ways that we do add or comment upon things that children do. And so in the natural environment, we do this regularly. So why is it, then, that sometimes these natural opportunities that we're presenting don't seem to work as well as the outcomes of the studies that we are conducting? And regularly when I work with children and I use this procedure and then I recommend it to the classroom, or I recommend it to a parent, the classroom or the teacher or the parent might say, I'm doing this, but I just don't see the same outcomes that you see. And I don't get why that's the case. And so I think it would be helpful to talk a little bit more about this so we can try to identify what is it about these two contexts that might differ in some way that are producing different outcomes. One potential option is that maybe this information isn't occurring enough. So maybe it doesn't occur enough each day, each hour, each week, whatever it is. Maybe people just need to comment more. That could be the case, but oftentimes when I work with parents or teachers, they're commenting pretty frequently. So although it might be that, oftentimes I find that people are already doing a lot of this, and so it's probably not just a lack of opportunities to do this, but certainly that could be a potential option. Maybe it's that the specific information isn't repeated frequently enough. And that could certainly be the case. So in the example I provided of the poodle, how oftentimes do we see a poodle, right? We have to wait for a child to say something like, there's a dog, and then we say, yeah, it's a poodle. Or maybe we see a poodle and so we comment on it again. But how often do we get to see a poodle? I can't think of the last time I've seen a poodle, quite frankly. So maybe we just don't have enough learning opportunities, or they're not being presented repeatedly enough or within a short period of time that we would actually benefit. I'll provide you with an example. Let's say that we are receiving foreign language instruction, and I've received a lot of foreign language instruction, but with a lack of practice over not that long of a period of time, I unfortunately lose the skill that I had, or I don't ever learn it to begin with. If we don't practice skills often enough, then we're probably not going to learn that skill. There's just too much time in between. And so it might be the fact that people are presenting this information, but it's just not occurring often enough, or the same information is not occurring often enough. Whoa, too far. So it might also be that we're presenting too much differing information. And I have certainly seen this to be an example. So let's say that a child is playing with an airplane, and the child says, airplane. I might hear somebody say, the airplane flies in the sky. Jets fly in the sky too. Airplanes carry people. The airplane's going to land on the runway. So they're presenting a lot of information, and that's wonderful, but it's a lot. And so what piece of information is a child going to learn when maybe there's 10 pieces of information being presented at a time? Particularly if that information isn't repeated. So it could be that they're doing a lot of this, but there's just so much happening at one time that it's simply too much. That could certainly be the case. I don't know. These are hypotheses, so I don't know whether this is the case. I'm just presenting some potential options. Maybe it's that the child isn't attending to the relevant material or a relevant aspect of that material. I would argue that this is probably a fairly likely outcome, and I'll give you an example. Oftentimes, when I see people presenting learning opportunities, unfortunately the child might be looking in the opposite direction of the learning opportunity that's being created. So for example, I've seen, actually I was working with this paraprofessional who was using instructive feedback when they were walking in the hallway, and they would put random things in the hallway to provide opportunities to kind of comment on things that were around. So the child was walking through the hallway, and they had placed a bike in the hallway, and they said, and the child said, "There's a bike." And the paraprofessional said, "The bike has a wheel," and they pointed at it. Well, unfortunately, the bike with the wheel was over here, and the child was looking at a door. And I don't know where they were looking at on the door, but it looked like the child was looking at a doorknob. So that is a wonderful learning opportunity, but unfortunately, the child is not attending to it. The child is looking the opposite direction. I see this happen a lot. And it doesn't mean that it's purposely happening. It just happens to be the case that the adult is providing learning opportunity and not looking at what the child is doing or whether the child is looking at the right thing. And oftentimes we find, particularly with children with an autism spectrum disorder, that they may not follow a point. So we might be pointing at something, but that doesn't mean they're going to look at where we're pointing. They might not follow a point. So we might be pointing over here and they're, looking around. What are you pointing at? So that can happen, and I do see this happen frequently. If that's the case, people are expanding upon what children are saying, but the child probably isn't benefiting from it because they're not looking at it. They're not pairing that piece of information that's being presented with the correct stimulus. And I would argue that maybe it's actually detrimental if we're saying, yeah, there's a wheel, and the child is looking at a door, because then the door is being paired with the word wheel as opposed to the bicycle wheel being paired with the word wheel. So those are things that we need to know when we're providing that instruction. Go ahead.
I just was wondering, because you're not expecting a response from them when you're providing the instruction. So would you, because if you were providing like a targeted, something that was their target skill, you would gain their attention. But would you gain their attention before you presented the IF? Because you're not requiring a response from them, but also you want them to learn. So would you prompt them to look or gain attention from them?
Yeah, that's a fantastic question, and I'll repeat it for the live webcam. So an audience member asked, if you're presenting instructive feedback, would you require the child to look at it the same as you would require a child to look at the information that you're presenting? And I would argue that would be beneficial to do so. Unfortunately, though, that doesn't always occur. In fact, some students and I have collected data in classroom settings in terms of how often are people requiring children to look at things, whether that be items that are presented during instruction or extra information. And it only occurs approximately 60% of the time that people actually require children to look at items. And I should provide the caveat, this was in schools around the state of Oregon. So that doesn't mean that that's the same in other locations. But within the state of Oregon, in the vast number of schools that we visited and collected this information, we found that about 60% of the time, somebody actually required a child to look at items. And the other 40% of the time, the child wasn't required to look at the items and oftentimes was looking a different direction. So I think that would certainly be beneficial to require a child to look at the item, and we are actually going to talk about that in a little bit. That seems commonsensical, and that, like, of course, we need children to look, but unfortunately, that's not always something that occurs in those environments. But certainly, we could argue that that would be beneficial. So that's a great question. Okay, the last piece, and this actually relates to that question to some extent, is that maybe there are some prerequisite skills that a child needs to benefit from this information. And so if a parent says, or a teacher says, well, I comment all the time, but my child's not benefiting from that, maybe there's some kind of prerequisite skill that the child doesn't have, and so they're not benefiting from that information yet. And I placed an asterisk there. I have a hard time with that word, which is why I dislike these. But maybe I should have put a star. Anyway, so I placed that little doohickey there. And that's because I want to talk more about this in a little while. All right. So I think maybe let's go ahead and take just a brief 5-minute break. You can go maybe get a snack before they go away and maybe have a chance to go to the bathroom. So we'll come back in, well, why don't we say 10 minutes, just because it's hard to do much in 5. So in 10 minutes, let's be back and we'll continue. Hopefully you're all back. All right, so to continue, so we're going to be talking now about behavioral mechanisms, and I recognize this is probably the driest piece of this presentation, so bear with me while we talk about this, but I can't underestimate the importance of really identifying what these mechanisms are, because that helps us determine why is it that these procedures work and with whom they might be likely to work. So although this is not always everybody's favorite topic of conversation, it is important nevertheless. I should also mention that many of these have been mentioned in studies, so I'm not necessarily making these up. I came up with a couple of these, but in many of these instances, these are things that people have already hypothesized as being potential behavioral mechanisms. So these are mentioned by other professionals in this area. So one potential behavioral mechanism is observational learning. And so when we talk about observational learning, what we're really talking about is that an adult models behavior, the child observes that behavior, and then imitates that behavior at some other point in time. And what's nice about the observational learning literature, although not critical in this instance, is that you don't really have to have, actually I should say is relevant in this instance, you don't really have to have reinforcement in place for the behavior that you're observing. So we can all think back to those Bobo doll examples if you had like a basic Psych 101 class where there were experiments where the adult, beat up that Bobo doll, and then, and if you don't know what I'm talking about, I'm sorry because I probably sound crazy, but it wasn't necessarily the case that the child or the adult had to receive some kind of reinforcement for engaging in that behavior. And although it did increase the likelihood of behavior occurring, it's not critical. And so sometimes we observe that students will imitate behavior despite the absence of observing reinforcement being provided for that behavior. So this certainly would make sense in the context of instructive feedback, which is that children are imitating what the adult does at some later point in time, and there's no reinforcement in place for imitating that behavior. So to some extent, this mechanism seems to apply. Another potential one that I think is certainly relevant is demand characteristics, and you're probably wondering, what do I mean by that? And so what I mean is that we have oftentimes in instructional contexts a really lengthy history of requiring students to respond and providing reinforcement for responding. Because this is what behavior analysis is all about. Frequent response opportunities, a lot of reinforcement for doing so. So we have this fairly lengthy period of time where children are exposed to these types of opportunities. You respond, I provide reinforcement. So the format of instructive feedback might look a lot like those opportunities that they have had in the past. And so a relevant question that occurred was, do children sometimes respond to instructive feedback? Because the demand characteristics might indicate that if you respond, you obtain reinforcement. We don't know a whole lot yet about whether children do or don't respond. We need to measure that more often. But this is certainly a potential behavioral mechanism, because it might be the case that we create these opportunities where it's very difficult to distinguish between instances in which that behavior will or won't produce reinforcement. And we'll talk about something that's like that in just a little bit. Actually, I should say one way to evaluate whether this is a relevant potential behavioral mechanism is to conduct instructive feedback in an environment that has no history of instruction. And I've started to do a little bit of this, and it seems to make a potential difference. So I have a lot of interest in this area. So for example, let's say that you have somebody who has never provided instruction to a student, providing instructive feedback in a setting where instruction has never occurred. And that might be something like a mall with your uncle or whatever. Your uncle's never provided instruction and you've never received instruction at the mall. So the question is, would these strategies still work in that context where there's no history of a requirement to respond or reinforcement for responding? And I think that's going to be an important question to answer as we learn about whether we can use these strategies in other environments where maybe an individual hasn't ever received instruction before. Some of those environments I said would be really nice to extend instructive feedback to, like community settings or social events or whatever it might be. This is not one that's been mentioned, but one that I would argue is probably fairly relevant, in that instructive feedback creates what Stokes and Baer, when they wrote their article about different types of generalization, and they talked about a great way to program for generalization is to use indiscriminable contingencies. And so what that means is that we create a situation in which it's unclear whether behavior will produce reinforcement or will not produce reinforcement. And if the contingencies for reinforcement are unclear, then we would expect to see someone engage in behavior because it's not clear whether that behavior will or won't be reinforced. We can make the same argument that we don't know if that behavior will or won't be punished. So for example, I'll provide a relevant example that maybe relates to all of you. let's say that you are driving on a freeway, and you know that on that freeway you hardly ever see a police officer, but they're there all the time because maybe there are trees or ways that they can obstruct their view, and so they hide there often. So it creates an indiscriminable contingency for a ticket. And so you might not be very likely to speed on that particular freeway because you have frequent exposure, and maybe you've even received a ticket on that freeway, to police officers lurking in the shadows along that freeway. And so in that environment, you might be unlikely to speed. But in an environment where perhaps you are confident that there are rarely police officers, maybe you would be more likely to speed there. We're talking about the same type of thing here. Basically, children might respond in circumstances where it's unclear whether reinforcement is or is not available. And this does relate to instructive feedback because we're not providing feedback, but sometimes the location of instructive feedback, it occurs in close proximity to reinforcement. And so if we think back to the example I provided of consequence-based instructive feedback, I mentioned that you would present that instructive feedback and then reinforcement occurs immediately thereafter. So let me provide an example of that again. We might be teaching the child to tell us the category for a vegetable. So we hold up a picture of broccoli and the child says vegetable, and we might say, that's great. And then we might say, cherries are a fruit. Okay, so that's the instructive feedback stimulus. Because the child said vegetable, they're going to receive reinforcement, and we provide reinforcement. But what happens is sometimes children might repeat what you said. So if I said cherries are fruit, the child might say cherries are fruit. They weren't required to respond, and I'm not providing reinforcement because they said that. I'm providing reinforcement because they told me that broccoli was a vegetable. And so that creates an indiscriminable contingency. Are they receiving reinforcement because they stated the target response, or are they receiving reinforcement because they happen to repeat the instructive feedback stimulus? That's unclear, that's indiscriminable. And so it might be the case that when we present certain types of instructive feedback, we are creating an indiscriminable contingency. And so we might see children continue to respond. This certainly would explain why children do respond to instructive feedback, even when they're not required to do so. And so why do they continue to do so if they're going to get reinforcement anyway? Maybe because the reinforcement is indiscriminable, or the behavior that produces reinforcement is indiscriminable. A good way that we could evaluate this is to look at those different types of consequence-based instructive feedback and compare those among learners. So recall that the other type of consequence instructive feedback is we actually present it while the child is consuming reinforcement. At that point, that's not really indiscriminable. I already have my reinforcer, and now you're presenting something extra. So the likelihood that I'm getting something for that behavior is pretty slim. And it might be the case we can evaluate this if we see differences in children's responding when we present instructive feedback right before reinforcement or during reinforcement. We would start to determine that maybe indiscriminable contingencies are a factor here. All right. So another potential behavioral mechanism is a generalized imitative repertoire. And what I mean by this is that children who learn to imitate sometimes imitate even though there's no reinforcement available for doing so, particularly because they have a very lengthy history of reinforcement for imitation. And so I'll give you some examples. When we're teaching children to, let's say, demand or ask for an item, maybe the child reaches for some item, and we get that item and we give them an expectant look, and if they don't say the name of that item, we might say something like apple, and if the child says apple, we give them access to that item. We can probably think of many examples in which we do that when we're teaching MANs. Maybe we also do that when there are items around us in the environment, and so we might point at this thing and say, what is that? And then the child is expected to respond. If they don't respond, we would tell them, that's a chair. And then they're expected to say that. So in a lot of the strategies that we use, children are expected to imitate our behavior, and they receive reinforcement for doing so. So it might be the case that perhaps children just generally imitate things that they see and things that are being done by people, particularly those people that provide reinforcement for imitation. And oftentimes the people who are using instructive feedback are those exact same people that provide reinforcement for imitative behavior in other contexts. So it might just be that this behavior generalizes. It generalizes to other skills, and it generalizes to other settings, but maybe the instructor is the same. Okay. Now, there are some similarities across these mechanisms, and I would say the similarities are the behaviors that are required for the individual. So, for example, ideally, the individual observes the instructive feedback, whether it be the picture or whether it be us pointing at something or whether it be us stating something. Hopefully, they listen to what we have to say. So we expect that hopefully they're attending to what we're actually doing. And we would love to see them imitate that response, although they're not required to do so. I would argue that that would be beneficial. Unfortunately, though, we haven't always seen studies measure these variables. So are children actually looking? Are children actually repeating? Sometimes studies do require children to look. And so that answers a question that somebody else had. Do people actually require children to look at instructive feedback? And there are many studies in which they are required to respond. So the instructor will say, look, but that's a study. And so whether that's actually happening in everyday practices is a different story. But we at least know that there are some overlaps in terms of behavior that would be beneficial for the individual to engage in that is relevant to many of these mechanisms. There are a few studies that have directly observed and recorded the occurrences of these behaviors. So whether it be repeating what the adult says, which is echoic behavior, so repeating preceding auditory stimulus. So if, let's say, I say book, you say book. If I say you read a book, the child might say either you read a book or the child says book. So there have been, there's at least one study that did look at echoic behavior and measured whether participants were engaging in echoic behavior, and all of the participants did. Let me remind you that that's a study that showed that for 3 of those 4 participants, this strategy worked really well without any additional instruction. However, there was still that one participant that echoed every single time, or nearly every single time, and still didn't benefit from the strategy. So sometimes that might be important, but we don't really know the boundaries or the certain behaviors that are critical to the effectiveness of these strategies. And then in a study that I'm going to describe for you in a little bit, some students that I measured whether students were echoing as well as whether students were actually looking at the materials when we didn't require them to do so. Were you going? Oh, no, that's okay. I thought I saw your hand.
Okay, I was going to ask a question, but
Okay. Okay. So we actually were interested in measuring these behaviors because these were students that had demonstrated some lack of attending and lack of echoic behavior, and so these seemed like relevant children to evaluate this with.
just wanted to be clear, the measuring of the echoic behavior in 2013, that's for the IAC and not for the target, correct?
Yes, children were required to respond, were required to echo the target if there was a prompt in place. So we would just continue to prompt until they responded.
We're measuring if they happen to echo.
The instructive feedback, yep. Yes, because that's really what we're interested in. They're not required to do so, but are they? Because I would argue if they are, that's probably a good thing. And if they're not, that might be detrimental. So we actually wanted to measure it to see, does this allow us to predict children with whom this strategy works and children with whom it doesn't? With the assumption that if this is an important behavior and children who do this, engage in this behavior benefit from the strategy and children that do not benefit from the strategy, then that allows us to figure out children with whom we should use this type of procedure. Does that make sense? Okay. All right, so there is only one evaluation I'm aware of that has actually tried to identify the behavioral mechanisms responsible for the effects of instructive feedback. And this is not yet published. This was actually a thesis that was conducted by a student named Casey Nottingham. She's at Caldwell College. And her advisor was Jason Pladescu. And she conducted a really interesting study that I'd like to share with you, where they actually looked at trying to identify one of these behavioral mechanisms. And what they did was that they presented instructive feedback in 2 different conditions, one in which they presented instructive feedback and the individual was permitted to engage in echoic behavior if that child did, and often they did. And then in another condition, they actually blocked the child from engaging in echoic behavior. And so what I mean by that is they might have presented the instructive feedback stimulus and then immediately required the child to say something else. So for example, let's say that they were teaching asparagus is a vegetable. I don't know why I keep using this example. Maybe I want to eat some asparagus. So they might have showed a picture of asparagus and said, what is asparagus? And the child said, a vegetable. And then they might have held up a picture of broccoli and said, broccoli is a vegetable too. Then immediately thereafter, they said something like, say book. And so the child had to say something different. they use that blocking procedure to see if they block the child from repeating the instructive feedback stimulus, maybe they wouldn't benefit from instructive feedback in a way that they would if they weren't prevented from engaging in that behavior. So what they found is that instructive feedback with blocking was somewhat less efficient. However, as we sometimes see children do, children find tricky ways to get around doing things. And so sometimes the children still echoed, they just did so after they said what the adult told them to say. So for example, if they said, broccoli is also a vegetable, say book, and the child said book, then they might have said, broccoli is also a vegetable. Well, you can't prevent everything. It might have been great to have some kind of really long requirement. So maybe if they said, sing the ABCs, and the child had to sing all the way through the ABCs, maybe they would have actually prevented the children from practicing. But sometimes the children still did practice, even though they tried to block it. So certainly, we can't always arrange things in a way, because we don't know how children are going to respond. We can't always arrange things in a perfect way. But this is a good example of how we might start to try to evaluate these, the effects of instructive feedback, and what is important and what is not important during this strategy. Okay, so that part is done. Maybe you're going to cheer. Yay! Maybe not. I mean, it's important, but I recognize that's not the sexiest portion of this presentation. It's actually the sexiest portion for me, but I recognize for you it's probably not all that interesting. All right, so moving on, let's talk about some behavioral repertoires that might actually facilitate learning of instructive feedback. I became really interested in this as I worked more with teachers and with parents, and they were saying, well, we're doing this already. But when I would observe them doing it, they weren't really doing it in the way that we were using it within the context of a clinic. And so, for example, we might have observed that they were presenting instructive feedback, but rarely requiring the child to actually look at the materials. And so I would argue maybe that's not as beneficial. And it seems like common sense to make somebody look at materials that you're presenting, but common sense is not always what people do. And common sense doesn't equal practice. And that's not meant to be stated in a negative way, but sometimes we just don't think about like what is common sense in these contexts. Or perhaps the people that are using these strategies haven't really considered how might a lack of attending impact these outcomes, particularly if somebody is using this procedure and doesn't have a whole lot of training. And so I work with people, and actually I started as a paraprofessional in a classroom setting, and nobody told me what to do. I received no instruction whatsoever, and I was with the child for 30 hours a day, and I was expected to come up with all of the instruction for the child. There was nobody who provided me with any guidance. They literally just said, here is what the teacher is doing. You figure out a way to modify that for the student. I was a freshman in college with no experience whatsoever in the area of autism. So I am very familiar with being given information to use and have no knowledge of how that might affect the outcomes for the student. And so I tried my best, but I didn't know what would or wouldn't affect learning because I had no experience in the area. And so this happens sometimes where people are being asked to do things, but not being given a whole lot of information. I can't guarantee that I used common sense in that instance. I'm sure there were many instances where I didn't have common sense, because that's just, the way that sometimes things happen. So I'm not stating this as if there are individuals who commonly do things that seem, like they shouldn't or should do this. The reality is people don't always think about how the things that they do affect a student's learning, but that certainly can. And so as I started to work with people and recommend that they use these strategies, I would see that they were sometimes using it in a way that was different than the way that we might have used it in another type of setting. And so I became very interested in evaluating certain behaviors that could lend to the effects of instructive feedback, or if these behaviors weren't occurring, might they prevent the strategy from being effective? Because if we can identify this information, then we can provide this to people who are using the strategy. This is basically almost like a treatment integrity manipulation. If you find what works, then you know you have to train people to do that. And if you don't know what works, then how do you know what to train people to do? You can tell them to do a lot of things, but what are the most important things? Those are the things that we need to know. What's most important for the strategy to work? So we included 2 participants. These children were as different as possible. Charlie had very limited vocal verbal behavior. He did ask for some items using one-word responses, so he did request items for basic wants and needs. but he really didn't know a whole lot about the world around him. He did not know the names of a lot of the items that he regularly encountered. He certainly didn't answer any questions. He had not received a lot of instruction yet. And he also engaged in some challenging behavior, particularly when people were providing instruction. He would attempt to escape from the chair if he was sitting at a desk. He would pull people's hair, he hit people, and he didn't always look at materials that were presented to him. And he would sometimes engage in problem behavior when people tried to get him to attend to materials. So understandably, he did not have a lengthy history of looking at materials frequently. And so he seemed like an ideal candidate to participate in an intervention like this, because we wanted to identify whether attending was something that mattered. Sally was quite different from Charlie in that she had received quite a bit of instruction. She spoke in nearly complete sentences. She had a wide range of labels of items. She could ask for a variety of items, but her instruction had almost completely overlooked teaching interverbals. So she had even learned some reading. She had learned some early literacy skills, but couldn't answer really basic questions. Like if you asked her what her name was, she couldn't answer that, or how old she was, or where she lived, or information that we might hope that a child with her level of functioning would be able to answer. That just had not been part of her instruction. So, so that was a skill gap for her, but she attended very well. She didn't really engage in too many behaviors that were inconsistent with instruction. But she didn't always repeat what people said. And so we selected her because we weren't sure that she was going to repeat the instructive feedback stimuli that were presented to her. And so we were interested to see, again, if someone who didn't consistently repeat instructive feedback may or may not benefit from this strategy. We did conduct all of these sessions in a private therapy room in an early intervention clinic. And the target stimuli for Charlie were common household items. And his mom actually selected the items that were within his environment that they really wanted him to learn the name of, because he was frequently encountering them. And they might state the name of the item and he wouldn't even go over to that item. So they wanted him to have more awareness of the items that were around him in his environment. And then in addition to that, he was becoming very interested in transformers, which was an activity that was consistent with his age, and a lot of his peers were also playing with Transformers, and so they were interested in having him learn some of the names of the Transformers that he played with so that he could communicate with his peers using the names of those Transformers. So, so we also taught him some Transformers names. And then for Sally, we taught fill-in-the-blank statements because that was not something that she had acquired yet. And the response were one-word responses to the fill-in-the-blank statements. So our dependent variables, or what we were measuring within the context of this study, were correct responses to targets. So the targets that we actually taught required a response or provided a prompt if the child didn't respond. And we defined a correct response as responding before the adult provided a prompt, or before we basically told the child what the response was. We wanted to know if the children were engaging in independent responses, because that's our measure of learning. We also measured correct responses to instructive feedback probes, and I'll describe more about that. But basically, that was responding within 5 seconds because there were no prompts and no feedback during instructive feedback probes. This was our way of measuring whether children were learning those materials without providing any type of instruction. We measured echoic behavior. I highlighted that in gold, I guess, because that was something we were really interested in. Were children repeating the instructive feedback stimuli that we provided, and were they attending? Attending was defined as looking at a material for 1 second, so that was really only relevant to Charlie, because Charlie, we showed pictures, but for Sally, we were presenting vocal information, and she would frequently look at our face, but it's kind of hard to measure attending to vocal stimuli. So we didn't measure attending for Sally, but we did for Charlie because we were showing him pictures. And our experimental design is lengthy and complicated, but I'll tell it anyway, and then I'll describe what that is. So it was an adapted alternating treatments design, and that's embedded within a multiple probe design across stimulus sets with a constant series control. You're probably thinking, what the heck is that? And if you are, that's fine. An adapted alternating treatments design is kind of a cool design when we're using when we are evaluating skill acquisition procedures, because what you do is you have different interventions, and each intervention has a specific set of skills associated with it. So usually those skills are all from the same type of skill area, but there are different targets in each intervention. And then we're basically looking at comparing the interventions to see which one works the best. And so that's a good design for conducting that type of evaluation. The multiple probe design means that we are teaching different sets of stimuli over time, and we're basically looking for one set of stimuli to be learned before we introduce training for the next set, before we introduce training for the third set. And then the constant series control is really primarily relevant to this study because we were teaching things that the children regularly encountered in their environment. And so a constant series control means you don't teach the skill, you just measure whether the child learns it without any instruction. And this is important because we're teaching, for example, Charlie, items that he learns in the environment all the time, or that he encounters in the environment all the time. So might someone just tell him the name of it, while they're interacting with him at home? Sure, they might do that. And if so, he might learn that, and that has nothing to do with our instruction. So we have to include some way to measure whether he's learning these materials that has nothing to do with our instruction. And so that was the purpose of the constant series control. All right, so during baseline or during our control condition, we would present materials, but we wouldn't provide any feedback for correct or incorrect responses. And we did intersperse or include maintenance tasks, so other tasks that we were teaching these children to give them opportunities to respond, practice some other skills, and receive reinforcement for doing so. During the instructive feedback probes, these were what we used to measure whether the children were learning the instructive feedback stimuli. So what I mean by that is following every intervention where we would actually embed instructive feedback into those learning opportunities, we then conducted a probe to see were children responding correctly to those stimuli. And this was our way of measuring whether children were acquiring or learning those instructive feedback stimuli, and we didn't provide any type of feedback for correct responses. We simply wanted to see if children were responding correctly, not tell them like, yep, that's right, or no, that's not right, because then we'd be teaching during those probes, and that really wasn't the point of those probes. All right, so our treatment involved using a constant time delay with error correction. I'm going to actually walk you through what that looks like, so don't worry about that for now. But during treatment, we included the instructive feedback in the consequence portion of the learning trial, so in the ending portion of that learning trial. And the specific type of instructive feedback we used was the consequence, where it actually, the instructive feedback was presented while the child was consuming reinforcement. So for Charlie, he was watching a video, and because that was his preferred type of reinforcement, or his most preferred item, so we would show him videos, and then we would present instructive feedback. For other participants, she would also watch videos, or sometimes she would eat food, and sometimes she would play with toys. So there was more variation there. But we presented instructive feedback while the child was consuming reinforcement. So let's talk about what these treatment procedures look like. And I'm going to give you an example of the constant prompt delay procedure first. That procedure usually begins with a 0-second delay, which means there's 0 seconds between the presentation of the question or information and a prompt. So, for example, we might have said, you eat pizza. And then if the child says pizza, we say, great job, and then give them a token or whatever the reinforcer is. Next, we would move to, not working. There we go. Next, we would move to a 5-second time delay, which means the child has 5 seconds to respond before we provide a prompt. So, for example, we might say, you eat, and then wait up to 5 seconds. If the child says pizza, then we'd say, great job, give them a token or whatever reinforcement is. Let's say, though, the child responds incorrectly or does not respond. So we might say, you eat, and wait up to 5 seconds. If the child said book, then we might say, you eat pizza. And if the child said pizza, we would say, that's right. So that's the time delay piece. Now we're going to add in the error correction. And the error correction was an extra opportunity to practice this skill that didn't require any type of prompt. We wanted the child to be able to engage in a correct, independent response before we left the trial, or finished this trial. So then we would present again, you eat. If the child said pizza, we would say, nice work. And then we would move on. So the error correction is that opportunity for the child to engage in an independent response before we move to another trial. All right, so let's go ahead and talk about Charlie's procedures, different from Sally's, because we were teaching different skills, and they had different types of responding, and so I want to talk about each of these differently. So for Charlie, we presented instructive feedback in the consequence portion of the learning trial, and so remember, we were teaching him common household items. So for a target, we might have held up a picture of a pan, and if he said pan, we would say, that's right, and provide reinforcement. And so, for example, he might watch a Cars video, a brief clip of a Cars video. And while he was watching that Cars video, we would present the instructive feedback stimulus, which involved maybe holding up a picture of a fork and saying, fork. For the first set of stimuli, we didn't make him attend. We just wanted to see how often he would actually attend to the presentation of those materials. Again, remember, this is a child for whom the school reported that he had a lot of difficulties with attending. And getting him to attend to materials was oftentimes difficult for them, and sometimes it evoked problem behavior as well. So we wanted to see just how often might he attend if we don't actually require him to do so. Well, actually, I should go back. That was for stimulus set 1. He didn't attend very often, and so we wanted to see, would he do better if we made him attend? And so for set 2, we required him to attend. That was challenging, so the school was right. Getting him to attend to those materials was not very easy. It took a lot of prompts, and it could have been because we were presenting these materials during the reinforcement interval. So he's trying to watch a video, and we're showing him a picture and saying, this is a fork, and he's trying to look around the picture and look at the video. That's fair. I would kind of expect children to do that, so that's not unreasonable. So what we did for set 3 was just move instructive feedback to the antecedent portion of the learning trial and see if maybe this worked a little bit better for him. So we presented instructive feedback first. So we might have held up a picture of a fork and said, fork, and then immediately moved to the target, which was holding up the pan. He has to respond to that, and then we deliver reinforcement. So we basically just altered where that was located. I should mention for set 3, because we moved that stimulus, we again did not require him to attend. We did not require him to attend. We just wanted to see if he would when it was presented in a different location of the learning trial. All right, so let's take a look at Charlie's outcomes. I am not going to show you this whole graph to explain. I'm just showing it to you for the purpose of providing some really quick information. The target, so what we directly taught, is represented by black circles. The instructive feedback probes, so these were our probes to see if the children were learning the instructive feedback materials, are the black triangle. And then the control, where we didn't actually teach anything, we just continued to present these materials, was the black square. And the first 2 sets had instructive feedback presented in the consequence portion, and the third set had instructive feedback presented in the antecedent portion. And then the last is just a set of stimuli we never exposed to instruction, just to see if he learned them without any type of instruction. Because again, these were materials that he saw every day in his home-based setting. All right, so let's take a closer look at each of these. So for stimulus set 1 in baseline, before we introduced treatment, he did not have any correct responses. We would want to make sure he didn't have the skill before we started teaching it. Then we moved to our treatment that had instructive feedback included, and we saw that he learned the targets, but we really didn't see very much responding to the instructive feedback materials. And that's not surprising because his attending was pretty poor. And I'm going to show those data separately. So we actually had to move to treatment for instructive feedbacks. We actually directly taught these, and it took about as long to teach those as it did to teach the targets. So this really didn't seem very advantageous. Not only was he not attending, but it took a lot of time for us to actually teach the skill once we moved to training. So, as I indicated, we then required him to respond, or required him to, to attend to instructive feedback in the second set. So this is the second set. In baseline, we had some responding in the control, but that's irrelevant. He didn't respond correctly for the targets or the instructive feedback materials. When we moved to treatment, we saw he acquired the targets, so that's great. But his responding to instructive feedback was variable. And again, we were making him attend, but it was not easy. So oftentimes we would have to say, look, and sometimes he would try to brush the card out of the way of the video, or he would block his eyes, or he would engage in a variety of different behaviors that weren't really conducive to attending and responding to the materials. Interestingly, though, he frequently echoed, so he would say what we said. He just wouldn't look at the materials. So I thought that was interesting, particularly because we saw this happen a lot at school as well. And the school would actually say, like, oh, he's responding. Well, he was saying it, but he wasn't actually looking at it very often. And so, as many people would imagine, if I'm trying to teach some skill and a child isn't looking at it, but they say what I say, that's great that they're saying what I say, but they're not actually looking at it. So they can repeat what I say. I already know they have that skill, but now I want them to actually learn the name of that item, and they would probably have to look at it to do so. Well, I would argue they have to look at it, not probably look at it to do so. So we did move to direct training of instructive feedback stimuli, and what we found was that he learned 2 out of the 3, but there was 1 that had a consistent error pattern, and so we didn't continue training. We just threw out that stimulus and taught it with another strategy. So for set 3, we now moved instructive feedback to the antecedent portion of the learning trial. We presented it first. And again, we didn't require him to attend. We just measured whether he did attend. And we see that in baseline, he had no correct responding. He did learn targets. He had some responding to instructive feedback probes during training. But when we actually moved to treatment of those materials, he learned them very quickly. So it only took 3 sessions, and he had those instructive feedback materials. So this is a good outcome for him. Let's take a closer look at what actually happened with our dependent variables that are our primary interest. So attending, meaning looking at materials, and echoic behavior, or repeating what the adult says. We see the percentage of responses along the y-axis, and the different stimulus sets are along the x-axis. Attending is that black bar, and echoic behavior is the gray bar. If we look at echoic behavior, we see it was fairly consistent. So as I said, he was repeating what we were saying, but attending was a little bit different story. So again, for stimulus set 1, he didn't attend very often. It's like about 40%. So he attended some of the time, but not as often as we might like. For stimulus set 2, when we required him to attend, that worked, but it was difficult. And I can't really recommend to a school to do that type of procedure when it was difficult for us to use, and so I really wouldn't expect somebody else to do something that's very difficult to occur, that's difficult to get in a clinic-based setting. That wouldn't really be a recommendation I would provide to somebody who maybe doesn't have the same level of training and maybe is willing to stick with doing something that's really difficult. So might it just work to switch the placement of instructive feedback? And sure enough, when we presented it in the antecedent portion of the learning trial, he attended often. Actually, that was, I think, the highest level of attending that we achieved. And what's interesting about that is we didn't require him to attend. So here, just switching the location resulted in him actually engaging in a lot higher levels of attending. And we saw in his outcomes that produced better learning outcomes too. So that's a helpful indication that both attending and echoic behavior are important variables for instructive feedback. Again, is this shocking? No, but it's still helpful to demonstrate. So Sally's treatment procedures were a little bit different. Yeah, go ahead.
Ask a question. Would you say that maybe unintended consequence was that when you switched the feedback to the antecedent, you were now using more positive reinforcement, where when you were presenting it during reinforcement, it was a form of negative reinforcement in place there?
That's true.
Because he was just saying it to get it out of the...
But reinforcement nevertheless. So, well, I would have probably not actually.
Negative or positive reinforcement.
It could be. That certainly could be a factor, but it's hard to say. We didn't really specifically evaluate that, but that is. Oh, we'll repeat that for the webcam. So somebody asked, is it important, or might it be explained that when we were presenting for stimulus set 2, we were presenting the instructive feedback and trying to get him to attend, but he wasn't attending? Might that be a form of negative reinforcement in that I just finally look at it to get it out of my way and get my opportunity to have you escape that learning opportunity? And that certainly could be the case. And in comparison to, maybe when we presented in the antecedent portion of the learning trial, there wasn't that, potentially aversive quality to the instruction. And certainly that could be the case. But that's not something we directly evaluated, but that's a good point. For Sally, we did the same type of thing, but we were teaching a different skill. So here we're teaching her to fill in the blanks. And I'm sorry, I keep using the exact same examples. But we presented this information in the consequence portion of the learning trial. So for example, we might have said, you wash your hands with, she said soap. We provide a reinforcement. She really liked Michael Jackson videos. This is a picture of Michael Jackson in Thriller, in case you're wondering. She doesn't like spooky zombies. This is just a picture of him that I could find on the internet for Thriller. And then we might have presented the instructive feedback stimulus, you read a book. And that was presented during the presentation of the video, or whatever type of reinforcement. So what we found is that actually for stimulus set 1, she did very well. And I'll show you those data in a little bit. For stimulus set 2, we found that after a little while, she wasn't echoing as often as we wanted her to, especially not as often as she had for the first stimulus set. So we decided to go ahead and require her to echo to see if this would make a difference. And so we included a requirement to do so, and what that looked like is when we presented the instructive feedback stimulus during reinforcement, we would say, you read a book. If she didn't say book, or if she didn't say you read a book, although she usually just repeated the last word, if she didn't say book, then we would repeat that stimulus every 3 seconds until she said book. So we didn't prompt her by saying, say book or book. We just basically repeated it until she said book. All right, so let's go ahead and take a look at her outcomes. The axis labels are the same as are all of the condition labels. Again, stimulus set 1 and 2 are our treatment, where we included instructive feedback. Set 3 is where we didn't provide any type of instruction and just saw if she learned these without any instruction, which she did not. And so for stimulus set 1 and baseline, she has no correct responding. When we introduced intervention, you see it took a while to teach her these targets. But what's interesting about that is that the instructive feedback stimuli were actually acquired very quickly. So you see two circles there, and there's a reason for that. The first circle is the acquisition of the first set of instructive feedback stimuli. Because she acquired them so quickly, we thought, well, why don't we just introduce the second set? So we did, and she learned those too. Yet she still hadn't learned the target stimuli, which I thought was a really interesting outcome. She was consistently echoing instructive feedback stimuli, so her echoic behavior was around 90%. So she was consistently echoing both the instructive feedback stimuli, and she echoed during targets too. But we were seeing a difference now in that she was learning these instructive feedback stimuli fairly quickly, but the targets were taking a little bit longer to train. So that's kind of an interesting outcome there. And one that I've seen with other children as well, which is interesting. For stimulus set 2, we saw during treatment, she was learning both the instructive feedback and the targets. But what we found is that there was one particular stimulus she wouldn't echo very often. And with the other two, she would echo them somewhat often, but with one, she was hardly ever echoing that one. And when we conducted the instructive feedback probes, that was the stimulus that she kept missing. And so we were thinking, well, if she's not going to echo this, she's probably not going to learn it. So we went ahead and required her to echo. And what we found is that she learned the targets, but she still did not learn that one stimulus. And it was interesting, when we required her to echo, she started to say no. So we would repeat it, and she'd say, no. And we repeated it again, and she'd say, uh-uh. So I'm not sure what was going on with that particular stimulus, but it did not appear that making her echo really had much benefit. And so we didn't actually conduct training with that stimulus. We decided to just go ahead and end the intervention with having her learn 2 out of the 3. And I'm not sure what was happening there, but sometimes children do things that we don't anticipate. All right, so to summarize the results, what we found was that for Charlie, the antecedent IF instructive feedback was actually better. We saw higher levels of attending and increased the efficiency of treatment. So that's an interesting outcome, and I'll explain why that's interesting in a little bit. For Sally, we found that the consequence-based instructive feedback was generally effective. She learned 2 sets of stimuli within the first set, and then she learned 2 out of those 3 stimuli in the second set. So overall, that was still a decent outcome for her. In terms of future research in this area, it would be important to continue conducting these evaluations with children who either do or don't engage in echoic behavior or attending behavior, because we need more evaluations like this. We did not fully evaluate whether attending is critical or whether echoic behavior is critical, particularly with Sally, because she echoed when we didn't think she would. She had a history of not consistently echoing, but when we presented that first set, she echoed almost all the time. And so we thought, okay, well, it's not what we expected her to do, but she did, and that's great. So we would need to have more children that we evaluate this. This is a preliminary investigation of some of the behaviors that might produce either a good response to instructive feedback or a not so positive response to instructive feedback. And if we know more about these behaviors, then that will allow us to identify with whom we should use the procedure and maybe with whom we should not. Or maybe what we should require children to do or what we don't need to require children to do. What's interesting about Charlie's results is that the antecedent instructive feedback tended to work better than consequence-based instructive feedback. Yet in the few studies that have compared these, they haven't really shown a difference in those outcomes across children. And it might be that with the particular children that were included in those studies, they didn't have conflicting behavior or behavior that conflicted with using instructive feedback, or maybe they all attended and all echoed, but we just don't know that. So it would be beneficial to continue to conduct these comparisons because there might be some children for whom certain types of instructive feedback are more effective than others. And if we know more about that, then we can make appropriate recommendations based on student behavior. Okay, so let's talk a little bit about novel applications of instructive feedback. A lot of what I've talked about thus far is prior research or maybe things that are consistent with prior research, but I'd like to talk about some other ways that we could use instructive feedback, kind of thinking outside of the box of what people have already done. So one way that we can think outside of the box is to use peers to provide instruction and instructive feedback to students who maybe have an autism spectrum disorder or a developmental disability, particularly if we are including children in general education settings. And I say that this would be effective because we already have some peer training strategies that are commonly used in general education settings. For example, some people use peer tutoring, and so peers pair up and they teach each other various types of skills within the context of some type of instruction. Like, for example, I see this a lot in math. So maybe two students are working in teams, and there's a tutor and a tutee, and then they switch roles, and so then they both are working on some kind of math task. So this does already happen in a classroom setting, and it would be nice to see if we can program peers to provide some instruction and some instructive feedback to students in that classroom setting for whatever might be relevant to the student with a developmental disability. It would be nice to see that peers can use this strategy effectively. There's no reason that they couldn't, but it would be at least nice to demonstrate that other people, and particularly students, can use these strategies with other students. This would certainly allow us to introduce this intervention into environments where perhaps students with developmental disabilities aren't participating as often. So that would be nice. Yes?
So would you, and I mean, obviously you don't know quite how you would set it up, but would you train the peers to do it?
I think some instruction would be important. And in fact, let me repeat that question. So the question is, would you train peers to use this strategy if they're going to be using it in a classroom? And I would say yes. I think you should conduct some training. Certainly when people are using peer tutoring, they do some instruction in terms of what peer tutoring should look like. So this is how you provide instruction to the tutee, tutee being, it's not like two and the letter D, the tutors, tutee. Just sounds weird. And so, yeah, there's some instruction that goes on with that. So this wouldn't look a whole lot different than that instruction. It would basically just involve, providing some instruction of a different sort to those individuals. But because we have demonstrated on a repeated basis, we, not me, but others have demonstrated on a repeated basis that peer tutoring works, there's no reason that peer tutoring couldn't be combined with instructive feedback. And that wouldn't involve a whole lot of extra instruction for peers. So we don't know if this would work, but it would be neat to see if it does. Okay. Other ways that we could do this, and this would be a wonderful extension, would be to use instructive feedback for play-related behaviors, and particularly really in any naturalistic context. So a lot of what I described is more of this, we have instruction, it's structured, but there are so many wonderful learning opportunities that are not highly structured. And we all use these probably on a regular basis with people with whom we work. And so it'd be great to see more applications of instructive feedback in this type of context. There simply isn't enough of that. And so it would be wonderful to see more of this. So for example, we see a lot of times that children with an autism spectrum disorder don't oftentimes engage in imaginative play or novel play. We might find that maybe they play with toys in a repetitive way, or they're not playing with toys in the same way as their typically developing peers are playing with them. So why might we be able to use instructive feedback to model some other ways to play with these toys? And again, the child doesn't have to respond, but it would be great if they had the opportunity to respond. And actually a colleague of mine, Laura Groh, when she was at the Monroe Meyer Institute conducting her postdoc, did some of this work with some of the clients that we were working with, and she found really great outcomes. And I think she actually did some more of this work when she transitioned to St. Cloud State University. But basically, we can use these procedures in that way, and it would be great to see more of this work being done, just to show that it doesn't have to occur in the context of trial-based instruction or structured learning opportunities, that this is also a very useful strategy that we can use in more natural environments. Another application of instructive feedback would be to increase some response variability. And again, I've placed that doohickey there. I don't want to say that word. There, because I want to talk a little bit more about this. Just out of curiosity, how many people here work with a child or work with individuals with an autism spectrum disorder? Okay, so many of us. And how many of you have observed repetitive behavior in the individuals with whom you work? Okay, so many of you, maybe not everybody, but this is a characteristic of that population, and we do frequently see that repetitive behavior occurs, And I'll provide an example of repetitive behavior occurring in the context of language, but it can occur in the context of a lot of other areas too. So for example, we might see that children engage in repetitive behavior when they're asking for things. And what I mean by that is they might use these repetitive, what we call man frames. So they might say, I want a cookie, I want water, I want blank, I want blank. That's great, they're still communicating, and so we encourage that. But after a while, that sounds really repetitive and is inconsistent with the way that typically developing peers will ask for things. So frequently, we would love to see more variability in the way that students ask for things. We also see similar outcomes sometimes when we're teaching tasks or teaching children to label things. They might say, I see a book, I see a table, I see a chair. After a while, again, that starts to sound really repetitive. And many typically developing children don't say things like that in a repetitive way. And so again, it'd be nice to get some variability in the way that children talk about things that they're seeing in the environment. We also might see this in the area of interverbals. So might children answer questions in a repetitive way? I've certainly seen this. I'm sure you can think of examples of that too. In particular, if you teach a child, like, how old are you? And they say whatever their age is, and then they have a birthday, and they still say that, maybe for a while. They still say their old birthday. I've certainly seen that. But other examples that I've seen is that you ask a child something like, how are you? And the child provides a blanket statement that really probably has nothing to do with the private event. Like, for example, I've asked a child before, how are you? When the child is crying, and the child says, I'm great, and they're just crying. And that probably has nothing to do with the private event, but that's what they learn, and they provide that response in a really repetitive way, which kind of makes this response pointless because it doesn't really indicate how they are. So we see sometimes this repetitive behavior, and it can be unfortunate because it's great that the person is communicating and using vocal verbal behavior, but it's not really occurring in an ideal way. So there are ways that we can increase variability. And I'll provide one example that has nothing to do with instructive feedback, but has been used to increase variability. And people have termed this as a lag schedule of reinforcement. If you don't know what that is, that's okay. We're going to talk about that. So a lag schedule of reinforcement means that you provide reinforcement if a response is different than so many others. So for example, if you're using a lag 2 schedule of reinforcement, if the response is different than the last 2, then you would provide reinforcement. That's some way to get variability, right? So that if the child says, I see a table, great, I see a chair, yeah, I see a blank. So you wouldn't do that. You would wait until the child maybe says, if you're using a lag 2 schedule, I see a chair, there is a table, that's an airplane. Okay, that is different than there is an I see. So I would provide reinforcement for that. So you're basically trying to increase variability by reinforcing variations of responding. And so this certainly works. It's been demonstrated to be effective, but this can be really challenging to use in a clinical-based setting, particularly if the lag schedule is high. So I'll give you an example. We use this to try to get increased variability in the way that children play, and we were at fairly high lag schedules, and it became nearly impossible to try to remember what were the last 5 things that the child did with that toy. When both hands are going and they're all over that toy, it's really hard to keep track of what the child is doing. And we might also find that it's really hard to keep track of vocalizations if they don't occur frequently unless we write them down. So sometimes a lag schedule is great but can be difficult to use. It might also produce its own form of repetitive behavior, and I've seen this too. So for example, if we use a lag 1 schedule, which means that the response has to be different from the last, sometimes we get these A-B patterns where the child might say, I see a chair, there is a table. I see an airplane, there is a computer, etc., etc. Again, like, that's still repetitive, just in a different way. So that's really not what we're going for when we're using these schedules, but sometimes that happens, particularly when children identify what's the schedule of reinforcement, which children are adept at doing. So that's a useful strategy, but maybe not necessarily the best one that we can use. There aren't a lot of other strategies that are available to try to increase variability. And I would argue that instructive feedback is one way that we can do that. And so I'd like to present you with an example of how we use instructive feedback to try to increase some response variability. Because I suspect that if you've worked with children who have repetitive behavior, the examples I'm going to provide might be something that you've encountered too. So when we were providing instruction to children within a clinic setting, a former student of mine, and I noticed that children started to provide very repetitive responses, even though they had a lot more response options available and that they had learned a lot more response options. And it tended to be instances in which we would say something like, tell me 3 animals, or what did you do today? Or what do you like to eat? And so the child would typically say the exact same things every time. They don't have to. They have a lot of other options, but that was their go-to response. And no matter what, they always said that same sequence of that. It might have been multiple word responses, but they provided that exact same sequence of responses every time they were asked that question. And that's unfortunate, particularly because preferences sometimes change. So if we say, tell me your favorite foods, we found children were answering this question in a way that was inconsistent with what they actually consumed at that period of time. So again, it's not really a relevant answer anymore. And so we wanted to find out, how could we increase variability? How could we get children to say different things to these questions? So we did so in two different ways. We used instructive feedback during training. So if we're teaching the skill, do we need to use instructive feedback from the get-go so that we don't allow children to establish these repetitive behaviors? Or might it be the case that we can use instructive feedback once repetitive behavior is already established? Both of these strategies would be helpful because sometimes we don't have any control in the training itself. Sometimes the skill is trained and the repetitive behavior is there. And so could we use instructive feedback to try to reduce repetitive behavior and get something else to occur? And so we wanted to evaluate the use of instructive feedback in both of these ways. So we included two children. Both were 4 years old, and they had very well-developed vocal verbal behavior repertoires. They had a high level of expressive and receptive language on standardized tests. They spoke in full sentences. They had numerous interverbals. And so most of what we were doing were targeting multiple word responses or trying to address other multiple word responses that had already been trained. And these sessions all occurred in private rooms in a clinic. There were two sets of stimuli, one of which were unmastered, so skills that the child had not yet been taught, and one of which were mastered stimuli, so skills the child had already been taught and had demonstrated a high level of repetitive behavior. So for this unmastered stimuli, these were not yet trained, and we taught skills that required 3 responses. And so it might have been something like, tell me 3 animals, or name 3 numbers, or something like that. And we identified 4 stimuli to include in training. And the reason we identified 4 stimuli is we wanted to be able to prompt different options. So sometimes we might have prompted dog. If we asked, tell me 3 animals, we might have prompted the child to say dog, giraffe, elephant. And in other instances, we might have prompted the child to say elephant, lion, giraffe, and every type of variation you could think of those 4 stimuli. So we were prompting variability in that we were trying to encourage children to model different recombinations of these stimuli. For the mastered stimuli, these were already in their repertoire and already very repetitive. So the children consistently provided the exact same response to every question. And again, when we conducted this training, we included 4 stimuli that we prompted in different combinations. So we looked at correct responses, so independent correct responses to the materials we hadn't yet taught, so the ones that we were exposing to instruction. And we also looked at 2 variables that I think are probably the most important, which are the frequency of novel combinations. So how often did they have a new sequence of 3 responses? So for example, if to the question, tell me 3 numbers, the child said 2, 1, 3 one time and said 3, 2, 1 another time, that would be 2 novel combinations because they're different orderings of those responses. But we also looked at the frequency of novel responses. So were they saying something that they hadn't said before? So for example, if they said 3, 1, 2, that counted initially as 3 novel responses, although every time they said it thereafter, that would not be any more novel responses. But if the child then said 7, 1, 3, that would be 1 more novel response because 7 had not yet been used. Does that make sense? Okay. So really, our primary area of interest is looking at those novel combinations and those novel responses. Because then, if it's novel, it's probably not going to be repetitive, or that would be the hope. So experimental design, we use a similar type of design to what I described previously, an adapted alternating treatments design within a multiple baseline across participants. We used a time delay procedure. This is similar to what I described before, but I'm going to go through it again. The first 2 sessions are conducted at a 0-second delay where we immediately tell the children the answer. That provides us with opportunities to prompt different combinations and different responses. And then the 5-second delay means the child has 5 seconds to respond before we provide a prompt. And again, we prompted different combinations, and we taught two questions at one time. So the first intervention was time delay. We did not have instructive feedback included in this intervention. This is kind of our standard strategy that we use to teach skills within our clinic. The next intervention, oh, actually, let me give you an example. So let's do an example of time delay. Let's say we said, tell me 3 numbers, and the child, 3 animals, not numbers. And the child said, lion, giraffe, dog. Then we might say, great job, and give a token or whatever it is that we were providing for reinforcement. So let's say, though, that the child doesn't respond. So we say, tell me 3 animals. And the child sits there and says nothing. Then we might say, tell me 3 animals, dog, giraffe, elephant. Again, we're prompting some different combination and maybe some different responses as well. And if the child says, dog, giraffe, elephant, then we would provide reinforcement. Okay, so now the second intervention that we looked at was time delay with instructive feedback. So here, this is the strategy we're trying to use to increase variability by adding some more information into that learning opportunity that hopefully the child would imitate. And so what that looked like is the procedure was just like what I described, except now we were presenting additional information about these questions after an independent correct response or a prompted correct response. So we provided it no matter what in every trial. And the instructive feedback stimuli were 4 additional examples from these categories. So let's say we were teaching animals, and if we had giraffe, lion, cow, and hippo as 4 responses, instructive feedback would be 4 more, like hamster and, I'm blanking on animals, a guinea pig and a pig and a zebra. So just some more examples that we would present. And otherwise, everything else was the same as in the time delay procedure I just described. So let me show you a visual example of that. Let's say we said, tell me 3 numbers. The child said 1, 2, 4. Then we might have said, great job, 3, 7, and 8 are numbers too, and then provided a token. So the 3, 7, and 8 is our opportunity to present that additional information. Again, the child doesn't have to respond, but it's our way to add some information into that learning trial where hopefully the child will respond in a less repetitive way by maybe incorporating some of those responses into their own response. So let's take a look at this graph. This is a graph for the stimuli that we trained. So these were the ones that the children had not learned and that we were training from the beginning. And we want to see, in this case, which strategy is going to lead to learning first. And so in baseline, both participants had no correct responses. We're looking at correct responding along the y-axis, sessions along the x-axis. The time delay with instructive feedback is the black triangle. And the time delay without instructive feedback is that open square. And so we see for Shane, he actually mastered the time delay with instructive feedback first. So that's interesting because we're adding a lot of extra information, but yet he learned this more quickly. And the same exact outcome occurred for Parker. So they learned the targets presented with instructive feedback a little bit more quickly than they learned the targets presented without instructive feedback. But this really isn't our primary area of interest. You see that they learned, that's great. What we're really interested in is whether they had novel responses, ones that weren't repetitive in nature. And we looked at this again in 2 different locations. So were they responding when, in novel ways when the task had already been mastered and we were trying to correct these already established repetitive responses versus when the skill was being taught from the beginning? So just to orient you to this graph, cumulative frequency of responses is along the y-axis and the novel combinations and novel responses are along the x-axis. Mastered is in the left-hand portion, and unmastered stimuli are in the right-hand portion. The time delay with instructive feedback is that black bar, and the time delay is the white bar. So if we look at mastered stimuli for Shane, we see that there really wasn't any difference in this procedure. And in fact, this really didn't produce much variability either. We saw only 2 novel combinations, which is the most minimum number of combinations you could possibly have, because there are only 2 questions. So there's 2 novel combinations, 1 per question. So these are already established, and he continued to engage in repetitive behavior. And for novel responses, we really didn't see an outcome there either. So for Shane, when the skill had already been mastered, so he had already established this repetitive response, this strategy really didn't work very well for him, including instructive feedback didn't work all that well. But it did when the skills had not yet been taught. So when he hadn't yet learned hadn't yet learned these responses, we see time delay with instructive feedback produced more novel combinations and more novel responses. So that's good. At least we see that it produces some more variability in a child that has demonstrated repetitive responding when we haven't used a procedure like this in the past. So let's take a look at the outcomes for Parker. His outcomes were a little bit different. So for mastered, we actually see he did a little bit better than when they were unmastered. So time delay with instructive feedback worked well once he had already learned those targets, and he had repetitive responding. But by introducing that instructive feedback, he started to say different things, and he started to recombine those responses in a different order. And so again, this is a promising outcome because he had a repetitive pattern of behavior already established, and we were able to resolve that by providing some instructive feedback. When we were teaching the stimuli from the beginning, instructive feedback didn't work all that well. So this is basically the opposite outcome of the other child. Both instructive feedback and time delay produced some novel combinations and produced some novel responses, but we didn't really see a difference between the procedures, so there wasn't really any notable difference. So sometimes this happens, you see different outcomes for different kids, but what we can say overall is that at least when we used time delay with instructive feedback to teach a new skill, it was more efficient for both participants. So it took less time to teach that skill. That's good. However, using instructive feedback produced different outcomes depending on the child. And so for Parker, it was better to use instructive feedback once those targets were already learned and repetitive in nature. And for Shane, it was better to use it before he established a pattern of repetitive behavior. It would have been great to see more consistent outcomes across children, but that's okay. Essentially, we just need to do this with more kids and find out with whom can we use this with to increase variability, and that's fine too. So the effectiveness of the timing of instructive feedback differed, but sometimes that happens. And so basically we could use it during training, or we could use it when the skill has already become very repetitive in nature, and hopefully at least one of those strategies will produce some variability in responding. Okay, so I'm going to talk about the clinical utility of instructive feedback. So we've talked a lot about research, and you might be thinking, well, do these outcomes really apply to the work that I do with children? Because I want to use this procedure over and over and over again. And in many of the studies that I showed you and that I presented, there's a single demonstration that it works. So they teach a single set of skills, or maybe they teach a couple. But they're not really using this like we might use to teach children skills over and over again over a lengthy period of time for maybe weeks or months or years. And so we need to know, is this going to be something that we can use on a long-term basis? And will this be something that people who are providing this type of educational opportunities are able to do with a high level of integrity? And what are some other clinical outcomes that we might consider, like, do the skills maintain over a period of time? Would using instructive feedback result in generalization? These are things that we need to consider when we're teaching strategies and we're teaching strategies in a clinical or educational setting. So let's talk about how we might apply instructive feedback to a clinical case example. And I'll give you one just so you can see what the long-term outcome of using this intervention looks like over a more extended period of time. So we do this on a regular basis with children in clinic-based services, so I'll just provide you with one example. But basically, we were looking at whether we could use this over an extended period of time. And for this particular child, we were teaching adjective noun tags. So for example, we might show him things in the environment, and he has to label that item as well as provide an adjective for it. So he might have to say brown chair, or black microphone, or black sweater, or whatever it might be. He needs to give both an adjective as well as a noun. He had quite a few one-word tags, so we're trying to expand upon those within the context of all the other skills that we were teaching. This is a single skill that we use this strategy with. And we had 6 sets of targets, so skills we were directly teaching, and then 6 sets of instructive feedback stimuli. And in each of those sets, there were 3 stimuli. So let me just provide you with kind of the round numbers for that. We basically taught a total of 18 targets and had a total of 18 instructive feedback stimuli, and we just taught them in sets. And we frequently use a constant time delay procedure, so that was a strategy we used for training the targets. And we've reviewed that twice now, so hopefully I won't go over that again. So what we really wanted to know is, will this strategy work when we're talking about a more lengthy exposure to instruction? And this occurred over the context of a 12-week span of time. So we provided this service within the context of a university, and that was the period of time that we had to work with this individual. Again, providing other types of teaching other types of skills too, but this was one measure of the use of this strategy. So in a 12-week span of time, we evaluated the utility of this procedure. And we looked for mastery, so whether the child was learning the skill, and we defined that as 5 out of 6, responding correctly on 5 out of 6 opportunities. And that was the same for the targets as well as the instructive feedback materials. To identify whether the child was actually learning instructive feedback, we did conduct probes so that we could learn whether the child was learning. It's redundant. And so we conducted these probes without any type of feedback. So we basically would just show the child the materials and see if he responded correctly. And as soon as we found that the child learned a set of materials, we moved to the next set. So we weren't waiting for these to be mastered in sets. Like, it's not as if the treatment and the instructive feedback set had to be acquired together. As soon as one set was done, we moved to the next set and just continued with the other set that was still in training. All right, so let's take a look at the outcomes. We see percentage of correct responses along the y-axis. All of the ones we directly taught are in the top panel. So these are, whoa, I went too far. These are the materials that are exposed to instruction. We are providing prompting, we are providing reinforcement. That's what's in the top panel. Those are all the dark data paths. And then the instructive feedback are the open data paths in the bottom panel. And so let's walk through these individually. For the first set of targets, we see he acquired those pretty quickly. Instructive feedback took a little bit longer. And so we were still in instructive feedback set 1 when we had already moved to treatment of instructive feedback set 2. When we moved to training of set 2. When we were in training of set 2, we see now that set and instructive feedback set 2 are mastered at the exact same time. So now they're basically like at a, set square 1, or they're kind of evenly matched. Then we move to set 3, and we see treatment took a little bit longer than instructive feedback set 3. So now we're actually training instructive feedback set 4 while still teaching set 3. Then we move to treatment set 4, but instructive feedback set 4 is mastered fairly early on, and we're in instructive feedback set 5 already. For treatment set 5, instructive feedback set 5 is mastered right away, and we're in instructive feedback set 6. And by the time we complete this, we see that actually teaching the skills took a little bit longer than the materials that were required with instructive feedback. So let me demonstrate this in a more user-friendly way. Which is just to show you the number of exposures that it took before the children actually learned these materials. The black bar are the targets, so what the child was required to respond to, and the gray bars are the instructive feedback exposures. So how many times did we tell the children this piece of information? And each stimulus set is along the bottom, and the number of exposures is along the y-axis. So what's interesting about this is, with the exception of set 1, the instructive feedback materials had to be presented less often before they were learned for 5 out of the 6 sets. Again, every time I see this, I think this is so weird. Like, we're directly teaching the targets, and they take longer to teach than does instructive feedback. It makes you wonder why we don't just use instructive feedback, quite frankly. So this is a good outcome, right? We didn't have to conduct any training at all with instructive feedback, and he learned those very quickly. And this is over a lengthy period of time. So essentially, we doubled the amount of information that he learned, because not only did he learn the 18 we were teaching him, but he learned the 18 that we weren't teaching him, that we were just telling him. I should mention that he did echo those instructive feedback stimuli about 90% of the time. So he was consistently responding, even though he didn't have to do so. So that's an important outcome, or that's an important point to mention. And because this is a clinical case, we measure a lot of other variables too, such as maintenance. And maintenance, it means that the skill continues to occur even after instruction is done. And so did we see that? Yes, we did. In fact, instructive feedback stimuli were maintained for a longer period of time than the targets were for 3 sets, or for the same amount of time as the targets were for 3 sets. So it was actually a little bit better maintenance for instructive feedback stimuli. Again, the materials to which the child did not have to respond correctly. That's odd. Generalization, we also measured that. So we were teaching these adjective noun combinations with the same materials. So we did present the same sets of materials in all of those learning opportunities. And so we wanted to see, would he provide that same response to a different example, the different exemplar of that. So for example, if I taught this brown chair, then we would show a different brown chair and see if he would have that same response. And we found that both for instructive feedback stimuli and for the direct targets of training, we saw a generalization of about 65%. So that's okay. We actually ended up teaching these extra sets, so we had to teach 35%. But without any additional training, we saw it generalized to 1 additional set. And that was exactly the same for instructive feedback as it was for targets. So there's no disadvantage in that area. And then I think probably the most important point here is that the person who was implementing this intervention was able to do so with at least 95% integrity. So they were able to implement this procedure fairly easily without it reducing the integrity of their instruction. And I think when we're talking about using this in other settings, measuring integrity is really important. We want to make sure these procedures are usable for other people who are using these strategies, who maybe don't have the same level of training as people who are conducting studies. So overall, what we found is that this is feasible in a clinical setting, and it produces all those outcomes that we really want to look for. It's efficient, it produced good outcomes in the area of maintenance, and it produced some generalization. So these are, and importantly, it was implemented with a high level of integrity. So these are helpful outcomes, yes?
I just have a question going back to the probes.
Yes.
You said in order for them to get mastery, it was 5 out of 6 probes.
5 out of 6 correct responses to a probe, or to 2 probes in a row, sorry.
Was that on the same day, or was that over multiple days, or did
It tended to be on a different day, but on occasion it might have been on the exact same day. But we didn't, because this was occurring in the context of other activities, it wouldn't be the case that, this is all that we did. So other things were going on. So, this was across the span of many days and other activities at the same time. But that's a great question. All right, so we're coming down the home stretch here. Hopefully you don't have to use the bathroom again, but feel free to do so if you need to. So let's talk about some considerations. Because if we're going to recommend these practices be used to teachers, we certainly want to make sure that we mention important variables that they should consider. And so what are those variables? Frequently, when I haven't provided these types of recommendations, or I haven't given people these considerations, I might see instructive feedback used in a way that I wouldn't necessarily consider to be ideal. And so I'll give you an example. One time I recommended that people add extra information in a learning opportunity, and I didn't provide a lot of detail. I told them how, but I didn't provide a whole lot of structure for that. And so I came back to that classroom a couple days later, and I found there was this gigantic stack of cards that they were going through. And so I don't know the number, but if I had to guess, it was like 200 different cards. And so they were cycling through these to present instructive feedback. I thought, wow, they identified a lot of things that the child needs to learn, but how many times are they going to be exposed to that stack of 200 over a period of time? And in fact, I came back, I think on day 3, and they hadn't yet gotten through that stack of 200 even once. And so I was thinking, that's not really necessarily what I had in mind, but I like the enthusiasm, and so that's good. They want to use it, and they want this to be effective. But that's not really how I would recommend it be used. So what I frequently do then is I provide this as a consideration. Now I've learned from those errors, we all do. And so now I recommend, well, you know what, it'd be helpful to identify a kind of small set. Really what I say to people is, how many skills do you typically teach at once? If you're going to teach, let's say, categories, how many of them would you teach? If you're going to teach question and answer, how many materials would you teach at one time? That's the same number of instructive feedback stimuli that you should select. And you can present these in a bunch of different contexts, but how do people keep track of them? And a lot of times people say, I don't know how to keep track of how many times I'm presenting it. I don't want to carry around a data sheet where I have to go through and check everything off. And that's fair if you're doing this across a lot of environments. That can be difficult to do. For a behavior analyst, we are all about collecting data, so maybe we wouldn't have as many concerns. But in a lot of classrooms and where there are paraeducators and other people providing instruction, they might not always have data sheets to collect this information. So how can we make this user-friendly? And so one way that I recommend doing this is that I tell them, if you have a stack of cards, you can place a blank index card on top of that stack. And every time you get to that blank index card, just put a dot there. And the next time you go through, put another dot there. And that will help you identify you have been through that entire set. And how many times you've been through that entire set is how many dots you have on that card. That relates to the next point, which is how often should they be conducting probes of whether children are learning these skills. That's difficult to determine, and there really is a cost-benefit analysis here. Do we want children to spend a lot of time in probes where they haven't really learned it yet, so do we need to conduct this probe yet? It's hard to identify this. So what I frequently recommend people do is conduct these probes maybe at the beginning of every day. And they don't have to do a lot of trials, but they have to expose the children to it to at least identify whether the child is learning. And so they conduct these probes at the beginning of every day when they first start using the strategy. When you find that the skills have been learned, look at how many dots are on that note card. Make a note of that. So I did this, let's say, for 4 days, and maybe I presented each one 10 times. So I've done a probe for 4 days. At the day 4, they learned the skill, and I happen to have presented instructive feedback, that set of instructive feedback 10 times. Okay, note to self, took about 10 times, 10 exposures for children to learn this. Then do it again and see how many dots are on that card the next time. And if you start to see some patterns where, okay, it takes about 7 to 12 presentations, that will tell you how often you need to do a probe. You don't need to do a probe until maybe you get to about that target range. And that just helps prevent people from doing things that maybe they're not as likely to want to do. Because sometimes conducting these probes are the biggest point of contention that I encounter in these environments, where people say, I don't want to have to assess the skill every day. And again, for behavior analysts, that's maybe not out of the ordinary, but in other settings, people don't always assess things on a regular basis. People assess things more on like a quarterly basis or some other infrequent basis. And so we need to be considering how are these strategies being used in other settings and how to make this usable in those environments. And so at least if we take kind of an empirical approach to determining how often these probes need to occur, then we can make some recommendations about how often people should do that, so they don't spend a lot of time doing something that isn't really necessary to do. And so I mentioned also that this takes some pre-planning. You need to identify some materials. You need to have a data sheet to conduct these probes. You need to have your index card there or whatever it is. So this takes some pre-planning. This isn't something that maybe people just say like, oh, I'll give it a try without having any type of pre-planning to occur. And I say this because this provides some information that who might be beneficial to work with to set up the strategy. So, for example, I wouldn't recommend that to a teacher just to give this to a paraprofessional and let them like figure out what to do with it, like I was given when I was a freshman in college. And so I would argue that there's some pre-planning involved, and someone should be working with other people to identify how to go about doing this. That could be any number of people. The teacher could be the pre-planner. It could be an autism specialist. It could be a behavior specialist. It could be whomever, a behavior analyst. Whoever is available to provide some supports in this area, at least initially, should be recruited to participate in this intervention. Because the last thing we want is to make these recommendations, have people do it without pre-planning, and then it doesn't work, and then you hear like, well, behavior analysis doesn't work. I hate when that happens. That's such a bummer to hear that. And so we don't want to perpetuate that problem by not providing the relevant supports that are necessary in order for these strategies to work. So I make sure people understand there is some pre-planning that's involved here. This isn't something that maybe you just do off the cuff every so often. You probably want to have some strategies in place to be identifying how often you're presenting things and whether the child is actually learning. So I think those are important considerations, and ones that maybe I'm speaking to people who already know these things, but it's not necessarily always the case that people think to do these things when they're providing these recommendations. All right, so last but not least, we'll talk about directions for future research. So one thing that people ask me a lot is, why do you think instructive feedback worked when you didn't present it in the learning opportunity? And so I mentioned when Jason Vladesco and I conducted that study, and we used instructive feedback only, it worked really well. So people ask me that a lot, and they say, why does it work so well? Because that is just like what I do. So at home, I am just telling my children things. That matches exactly what you did, but I don't really see what you saw. And so we've talked about some of those issues before, and I might argue it could be because the manner in which we were conducting this study was still instruction-like. And so, for example, this was one condition, instructive feedback only, which was embedded within a lot of other training that was going on in that exact same setting, not with that exact structure, but in the same setting with similar looking materials. And so might it be that this worked really well because there was, again, that demand characteristic, or the fact that we were providing instruction in that environment, the child was usually required to respond, and so this is a little bit different than maybe using instructive feedback in other environments. But I would argue when we need to do that, let's find out if this really matters. Do we have to embed instructive feedback in learning opportunities, or can we simply pick a set of information to strategically tell children on a regular basis? And if it's that simple, then that would make our lives really easy. If we don't have to embed it in something, then that means when a parent's on a trip to the grocery store and they're riding in a car, they could just say stuff to their children. Now, they would have to be strategic in what they say. They would have to pick a subset of things and say those repeatedly. but might that be beneficial? If they don't actually have to be presenting a learning opportunity at the same time, I think that would be very beneficial. So we need to learn more about that. Can we do that? And in what environments is that going to be feasible to do? I would also argue we need to evaluate more information and evaluate more about behavioral repertoires that are going to be necessary to benefit from this procedure. So some of those prerequisite skills. Quite frankly, evaluating prerequisite skills for many of the things that we do would be beneficial, and that is a limitation to a lot of areas of research within behavior analysis. But let's go ahead and correct that. Let's find what are these relevant behaviors? What do children need to be able to do to benefit from this procedure? And if they don't do that, let's teach them that skill so that then they can benefit from this procedure and probably benefit from a lot of other procedures too. And we just don't know what those skills are yet. So the more we evaluate those, the better able we are to identify with whom this will work and with whom this might not work until we teach these skills. Did it go forward? Nope. So another area that is understudied, and I've already talked about this a little bit, is parents using instructive feedback, and I honestly can't state this enough. I think that this is such an important area to extend this literature to. How can we have parents who provide so many wonderful learning opportunities to their children use this strategy? They probably already are using it anyway. So can we evaluate whether they can just do it a little bit more strategically? And how do they respond to it? You know, do parents like using this strategy? Do they feel that it's useful? Is it manageable in their whatever environment they're in? And so that would be an important extension of this research to really show that there are other people who regularly provide instruction to children who can use this strategy and find it to be acceptable. And then finally, it would be great to identify how many instructive feedback stimuli we can teach at once. So everything I presented thus far has involved one extra piece of information and a learning opportunity. But there has been a study that has looked at presenting two. So if we can get one, can we get two? And if we can get two, can we get three? We're probably always searching for more, trying to seek ways to make instruction as efficient as possible. And the study that evaluated this actually found that you can present two pieces of information as long as those pieces of information are related. But that's a single study. And so certainly there's more work to be done in this area. And in what way are they related and how much information might vary. But this would be a great thing to identify too, because this would just further enhance the efficiency of instruction. And you are probably all here because the title talked about enhancing efficiency of instruction. And so you probably want to find ways to make learning occur as quickly as possible, particularly with children with an autism spectrum disorder, because we want them to catch up to their typically developing peers as much as to the extent that that's possible. And the more we identify how much information we can add and how much children will benefit from that, the further we can enhance this instruction. And that's it. Does anyone have questions? Thoughts? Comments?
I have one.
Yes.
The taking it out of the learning opportunity, like it's embedded.
Mm-hmm.
I'm trying to think about that and how to do that, because the consequences are what cause behavior to occur again.
I know.
Can you really fully take it out of some sort of
Mm-hmm.
instant behavior consequence situation?
Yeah.
I don't know. I mean, I find that challenging to think about.
I know. It is strange to think that children aren't required to respond and there are no consequences, and yet they still learn. That's why when I read about this research, I kept thinking, this is very strange. Like, I just can't believe it. It's almost unbelievable. Until I started using it myself, and I thought, this is why we have to identify the behavioral mechanisms. It's almost like what we know about behavior analysis doesn't apply here. Those fundamental pieces of learning aren't present in this opportunity. They might be. I mean, the child might be responding, so maybe they are present. But the fact that there's no consequence is weird, and that the children continue to respond and that they benefit from that procedure is very strange. So I agree with you. It's really weird, and how can we continue to do this? And would it work? I don't know. I think we need to determine that. But it would be great if it did. So if we could just tell children things, and we did that in a more strategic way than maybe the way we do it now in the natural environment, which is to probably say a lot of different things. If we said the same things, just picked a set of things that we repeatedly said, if that worked, that would be wonderful. That would be easy to do and pretty beneficial. And then pick another set of things and say those. That would be cool. Yes.
I was going to say, to follow up with that, unless perhaps the environment was already had a history of learning.
Mm-hmm.
For example, if you compared
Sure.
somebody somewhere had taught you to do something, you followed it, and you received some kind of feedback.
Mm-hmm.
I don't know, comparing two, that would be two confounding variables, but comparing situations like that.
I think that's I don't think there'd be too many confounding variables there. I think that's a great suggestion. So basically, you show the strategy works in the setting that is associated with instruction, and then see if it works in another setting. I mean, you know it works there, so you basically show, it's not that the procedure doesn't work for this child, it works, but now let's just do it in a totally different context, like the mall, with whomever has never provided instruction, but is taught to do so. I think that would be great. I think it would be really interesting to see if that's the case. I would suspect it wouldn't work as well, but quite frankly, a lot of what I think to be common sense is not really applied in this instance, and so what I suspect is probably irrelevant, quite frankly, and maybe irrelevant in general. But yeah, I would be interested to see what happens, and it would be very cool if it worked. But I guess if it didn't work, then how much do we need to structure an environment with some kind of learning opportunities so that it does work? So for example, let's say that we conducted some kind of evaluation, whether it be an actual study or we just kind of strategically did this in our own practices, where we found instructive feedback worked in school and maybe it also worked at home, and we want to say, well, does it work if I take the child to some kind of outing, or somebody else takes the child to an outing, and let's say it doesn't. So you think, okay, well, it didn't work there. What do I need to do in that environment to make it work? How many times do they need to be exposed to something there for it to now work? Because it might not be much if it didn't work, and then maybe I just need to have a single or a couple instances of learning in that environment, and now it does work. That wouldn't be a really big endeavor. It wouldn't be a lot of effort on our part to make that environment much more effective. So I think that could lead to a whole host of questions to be answered there. All right, well, thank you so much for being good attendees.
Thank you so much. All right, thank you very much. That was very interesting and I have a lot to think about. All right, let's see the code here. The code is OUT 456. All right, so it's OUT 456. All right, thank you.